1919 was an auspicious year in history. The First World War ended, ushering a drastic change in the world order. The Philippine Islands had been a U.S. territory for 2 decades and was promised independence under the Jones Law of 1916. Progressive reformers saw the country and its people as a major target for modernization, and education was its main weapon. 7 forward-looking Filipinas came together in 1919 to create a school where young women could gain the knowledge and skills that would make them modern women. Paz Marquez Benitez was the first president of the Philippine Women's College. Jose Abad Santos was its first chairman of the Board of Trustees. Francisca Tirona Benitez was the second president, and with her husband Dean Conrado, guided the school from a house on A. Flores Street to its iconic Taft Avenue campus. In 1932, the college became a university, making PWU the first university for women in Asia founded by Asians. It provided a space where innovations in education flourished, and young people were encouraged to be the best that they could be. For over 100 years, the Philippine Women's University has been known as a leader in quality education. In 1934, PWU moved into its main campus on Taft Avenue, and since the 1970s has been co-educational. Located in the heart of Metro Manila, it is easily accessible by public transport and surrounded by affordable housing. Today's PWU offers undergraduate and graduate courses in several fields of study. Its business and management programs are responsive to the needs of industry, using evolving technology for global competence. PWU graduates excel in arts and sciences, education, social work, and diplomacy. Its fine arts and music programs have produced outstanding graduates through a holistic education that treasures heritage as well as excellence. PWU has pioneered in fields such as food science, nutrition and dietetics, medical technology, pharmacy, and nursing. PWU continues to play an essential role in producing graduates who possess the skills that make them competitive in the country and anywhere in the world.
A united community.
We may not be blood related,
but we Patriots are one big family.
Being part of the PWU community strengthens us.
Through the years, we support each other through good times and bad times.
We Patriots always have each other's back.
It's a big honor to be part of a community that is open to to the ideas of each other.
Drives us to excel and be the best version of ourselves.
That's the standard of excellence that we Patriots strive for.
I'm thankful that this community lets us be who we want to be.
We thrive because we accept each other for who we are.
And like a family, we treat each other equally.
Actually, PWU gave us a home and helped us to be a patriot in society.
We may have different individual drums and instruments,
but we march with the same beat together as one united community.
Do you want to march with our community of patriots?
I am a patriot.
I am a patriot.
I am a patriot.
I am a patriot.
Good morning, everyone.
Magandang umaga sa inyong lahat.
早上好. Welcome for today's webinar entitled Innovation and Current Trends in Healthcare Technology, Nursing Education and Practice.
My name is Adelson Abigitero.
And I'm Tara Yang, but you can call me Cindy.
And we are your hosts for today's webinar.
Distinguished guests, professors, students, and classmates, ladies and gentlemen from all regions here in the Philippines, in China, and all over the world once again, welcome for today's school's nursing webinar entitled Innovation and Current Trends in Healthcare Technology, Nursing Education and Practice. Yes, indeed, Mr. Alderson, we are in full pack this morning. We are also live simultaneously by Facebook Live. 你好，中国同胞 to my fellow man.
Before we start, let me call on Ms. Shara Gail Malikat, our classmate, to state some of our webinar house rules and guidelines.
Good morning, everyone. For our webinar house rule guidelines, please ensure a stable internet connection once you have registered. To prevent background noise, all attendees will be on mute mode throughout the session, with the exception of the resource speakers and coordinators. Type your questions in the question and answer box. Questions will be answered at the end of each speaker's discussion. E-certificates will be issued only to registered participants who will accomplish the post-webinar evaluation to be announced at the end of the webinar. Please use your registered full name and email address in answering the post-webinar evaluation. Please double-check your email address as webinar organizers will not be responsible for any incorrect data submitted. Make sure to answer the evaluation form before leaving this webinar session. Evaluation link will be posted on the comment box and will be flashed on your screen along the QR code. Failure to fill up the evaluation form will result in no e-certificate. Attendees' requests for the evaluation form on PWU official Facebook page and email after the webinar will not be entertained. Participants who will accomplish the post-webinar evaluation will be cross-validated using the list of official registered participants. E-certificates will be emailed to the validated participants at least 1 week after the webinar. By joining this event, you agreed to participate in a webinar that will be live streamed in PWU and PWU School of Nursing Facebook platforms. Relax and enjoy the innovation and current trends in healthcare technology, nursing education, and practice webinar.
Thank you for that, Mr. Shara. And now let us put ourselves in the loving presence of the Lord as we start our event with an opening prayer to be followed by singing of the national anthem and PWU hymn.
di mo'y buhay. Lupang hinirang, duyat ka ng magiting, sa manlulupig, di ka pasisiid, sa dagat at bundok, sa simoy at sa langit mong bukaw, may dilagang tulad, awit sa paglayang minamahal, ang kisap ng watawat mo'y tagumpay na nagdidigdig, ang bituin at araw niya kailan pa may di magdidinig, lupa ng araw ng wal, at ipagsintabay langit sa piling mo, aming ligaya dapat may mga ami ang mamatay ng dahil sa'yo.
To formally welcome you all, we would like to call on our class president, co-webinar facilitator, Mr. Herwin C. Calagdo.
To our university president, Mr. Marco Alfredo Benitez, our Dean of the School of Nursing, Dr. Minerva B. De Ala, our subject professor, Professor Zenaida H. Kilakil, our beloved faculty members and staff, fellow students, nurses, distinguished speakers, and guests. Ladies and gentlemen, good day. It is a great pleasure to welcome you all for today's webinar with the theme Innovation and Current Trends in Healthcare Technology, Nursing Education, and Practice. This webinar is curated based on the topics of nursing leadership in times of pandemic, current trends in nursing education, leadership in times of pandemic to include best practices, effect of COVID-19 to nursing education, innovations in airway management, and current status and trends in robotics. By the end of this webinar, attendees will gain knowledge on updates in nursing education, adopt practical strategies that can be used in nursing practice, and explore innovations in healthcare technology. Today, we are very fortunate to have our respected discussants share their first-rate expertise and experiences. Finally, we would like to thank you for participating in our webinar series.
Thank you for the warm welcome remarks, Mr. Heroin. So today, our first speaker was graduate of Makati Medical Center, College of Nursing. She is a Master of Arts in Nursing graduate at La Concordia College and a Doctor of Philosophy graduate at Southeast Asia Interdisciplinary Institute. She worked at Makati Medical Center for 29 years, from 1979 to 2008. From staff nurse up to Director of Nursing, Chief Nurse Office Service Division of St. Luke's Medical Center, Global City, Taguig for some time at Mountain Grace Hospital, Inc., a member of the United Laboratory Group, the Philippines' largest pharmaceutical company, and President of the Philippine Society for Quality in Healthcare. She is an experienced chief nurse with a demonstrated history of transformational leadership in the hospital and healthcare industry. Skilled in both physician and cooperative relations, nursing and clinical service with a strong focus on nursing administration. A co-author of the National Nursing Core Competency Standards in the collaborative effort with the Philippine Regulation Commission, Board of Nursing, Commission on Higher Education Technique Committee for Nursing Education, and the International Labour Organization as a contribution to the enhancement of nursing education and practice in the Philippines. Now, let us all welcome to discuss nursing leadership in times of a pandemic, Dr. Marilo Furiel.
Good morning, everyone. It is my pleasure to be invited to be a resource speaker to talk about nursing leadership during pandemic. Okay, I would like to share some videos with you with regards to the pandemic because RightMed sometime 2 years ago invited me to deliver a message as a tribute to the nurses at the front line during COVID-19 surge in 2020. Now, I would like to share some slides to share with you how it was 2 years ago, because after 2 years, we have become better related to the vaccination, but it was harder 2 years ago. And I would like just to bring you back, freshen your memory at the toughest hours of our COVID before I wrap it up with the leadership approaches that I did during the pandemic. So next slide, please. the first challenges na hindi ko kayang isulat lahat. So, challenges na nakikita ko bilang nursing service administrator is number 1, lack of nurses related to fast turnover rate and the imposition of the K-12 program. So, saan ako kukuha ng nurse, di ba? Kaya nangyayari ngayon, nagpipiratahan na ng nurses eh. Siyempre, mas maraming napipirata yung government kasi mas mataas silang magpasweldo. So talagang ang private hospitals, sila yung naiiwan. So kumpleto yung government hospitals, kami, kulang. Okay? So yan ang mga challenges namin. Isa pa, kung meron man kami mga nurses, ito ay mga greenhorns, mga bata. We call them novice and advanced beginners. They don't have enough experience. And kulang din kami sa matured nurses to mentor them. So, makikita mo talaga na nagsusurvive sila na talagang they have to learn from their own. Kailangan bilisan nilang matuto. Kung ayaw nilang masigawan, ayaw nilang maireklamo at mai-complain, on their own talaga, sinisikap nilang matuto. Na in an ideal setup, ito dapat ay dumadaan sa programang mas mahaba-haba ang orientation at in-service bago mo ilublob sa trabaho. Now, we have no more time for that. The nurses are needed at the front line. Thirdly, there are mental health challenges leading to increased resignation and absences. Siyempre, pandemya ngayon eh, yung hindi nga nagtatrabaho sa ospital, napapraning eh. Mas lalo na kaya yung kapiling mo yung may COVID.
Tama.
Everybody is busy at the front line because of the diminished number of nurses. Kulang ang nurses. So there is no time for formal in-service training. Eksakto lang yung tao mo. Hindi mo sila pwedeng i-pull out. May training tayo bukas, we will study this. Hindi makaka-attend yun kasi makukulangan yung area. Ang talagang hindi namin pinupostpone na training ay yung mga mandatory like basic life support, advanced cardiac life support, kasi talagang yon required, saka talagang dapat alam nila. But the other programs are postponed indefinitely simply because we cannot pull them out. Kukunti lang sila. Talagang yung importante, pinipili lang namin. So, marami pang iba yan. So, those are just the few.
Okay, those were the challenges of the first year of pandemia, which put all nursing administrators into the dark of management. We had no experience on this, and so we really then did not know how to do it. We only had to be creative in our approaches in order to be able to deliver the care safely for the patient, and more importantly, safely for the nurses. The next video will be telling you about experiences of nurses, their stories during COVID times. So can we have the same bit, this next video?
Go to another story, the story of Betty, not her true name. So, mga bandang March, nagkaroon na ng pandemya. So, nagkaroon ng mga panic ang hospital, nauso na yung mga magre-resign ako, aalis ako, ayoko na. Kasi we do not know much about that. So, si Betty has a newborn child and was a breastfeeding mother. So, nung nauso yung pandemya, sabi ng asawa, tumigil ka na. Kasi baka yung virus, may uwi mo, ay magpapadede ka pa sa anak mo, ay baka ma-infect mo. So, yung nanay niya, yung biyanan niya, yung asawa niya, everybody in the household wanted her to resign. Ngayon, nagpaalam siya sa akin, umiiyak siya, "Ma'am, magre-resign na ako." Bakit naman? Kasi yung asawa ko, yung nanay ko, yung biyanan ko, yung anak ko, ganyan-ganyan. Pero when she was crying, she said, "Pero ma'am, nursing is one thing I want. Nursing is one job I do best. This is the only thing I want to do." Yan, naiiyak tuloy ako. So, correct.
So what I did is, okay, I give you a 1 month leave. I call it time out, just for you to think over it. And then let's see after 1 month. Come back after 1 month. If you're not decided, I'll give you another time out. Just think about it. So, nag-time out siya, and then bumalik naman siya, and then yung family natanggap na rin na talagang gusto niya magtrabaho. Tuloy-tuloy yung buhay namin. So ito, the nurse is putting her life on the line for her kids, for her family, because she may carry the virus going home. Eh alam naman natin kahit doktor, kahit nurse namamatay sa COVID, kahit gaano kagaling yung kanilang mga infection control practices. Now let's go to the story of Cathy. Si Cathy, alam mo yung mga sa ospital, meron kaming COVID ward, meron kaming non-COVID ward. So sa COVID ward, pagka nag-absent yung isang nurse dyan, hindi ka pwedeng kukuha ng nurse sa clean area. Kasi cross-contamination. So yung team na yun, pag may nag-awol dyan o may umabsent, wala nang papalit. O wala kami kasi kulang din ang nurses sa ibang area. Wala kaming pupull outan. So itong si Cathy, she volunteered. Ang duty niya ay 6 a.m. to 6 p.m. Meaning, 12 hours na siyang nagtatrabaho. But she volunteered to continue on from 6 p.m. to 6 a.m. That is a total of 24 hours. And siyempre, that's not right, no? That's against the labor law. Yes. But she volunteered. She volunteered because she said she cannot leave the patient without a reliever. Kasi kung di siya magdediretso, yung supervisor ang magbe-bedside. So what we did is, sinamahan siya ng supervisor so she can take a nap every now and then. So what is this telling us? Kayo mga public, kahit nagagalit kayo sa amin, kami mabagal, kami ganito, ganyan, hindi namin kayo iniiwan. Hindi namin kayo iniiwan. So you see, not everyone lives for abroad. There are those who stay. And those who stayed make the best of what they can do in every given situation.
Okay, I will let us shift to the lecture proper now. Can we have the next PowerPoint? Okay. Let's focus now on nursing leadership. Leadership is the capacity to influence others through inspiration, motivated by passion, generated by vision, produced by a conviction, ignited by a purpose. Leadership is about influencing others. They have to believe the leader. You cannot be a leader if they don't believe you. And the thing that will make them believe you or be influenced by you, if you demonstrate that you have a vision, faithful to the vision, and you're passionate in reaching that vision, and through role modeling, they know your pathway, you show them the way how to reach for the goal. So, walang sumusunod sa leader na hindi alam kung saan pupunta. So it's very important for the leader to be able to influence, to show the way all the time. Okay, next slide. Leadership in times of crisis. Disasters can make or break a leader. In the era of COVID-19, some leaders have risen to the challenge, keeping their communities, employees, and students informed, pausing and restarting daily life, and managing the secondary effects of social and economic disruption. During pandemia, a lot of businesses have shut down, or they have reduced their workforce because of the quarantine, there are no people around, and of course there are no businesses. So it caused a lot of economic difficulties. Hospitals, being an essential business, have thrived, but not as profitable as when operating on normal times. So we need the corporate leadership, the clinical leadership, the nursing leadership to be very, very stable in times of crisis. Very innovative and very innovative and very persistent in what they do. Like as compared to other leaders who are not prepared in crisis management, they are floundering, communicating poorly, not providing trustworthy information, and failing to follow through their promises. So during disasters, people must believe you, otherwise they will not follow you. This is how you influence people. You role model, you show them you know where to go, people believe you're leading them somewhere, and because you have good communication skill, you have integrity, you say what you want to say, and you do what you want to say, and you show them by work what you want to happen. Then people believe you. You influence them. Okay, next slide. In addition to the challenges during pandemic, which sometimes is still happening now, for the nursing staff during ECQ, there's difficulty transporting going to work. So this made the hospital invest on transporting the staff, like, renting vans, buses to ferry the staff from house to work. Accommodation, because some of the staff would not want to go home. They don't want to infect their families. So they would like to stay in the hospital. Other hospitals put some quarters to accommodate the staff. This is also an investment. So plus the daily disinfection of the hospital, this intervention have added up to the expense of the hospital. Kaya during COVID, mahal magpa-hospital because of added expenses. Of course, it has impact on the staff's mental health, and then understaffing, because before pandemic, we are already experiencing understaffing, and this was highlighted due to increased resignation for fear of the COVID. And because we were understaffed, burnout follows. For hospital owners, they experienced lower census, and there was problem in business viability because we lost all the elective cases and nobody wants to go to the hospitals. The senior doctors don't want to hold clinics, so they have, because of that, then you don't have patient for admission because nobody is consulting. And those who go to the hospital are really those who are really in serious condition. And because of COVID, there was an increased need in supplies use and change in structure and facility renovation to contain the virus. So these were the changes during the initial impact of COVID surge. Next slide, please. 7 things the best leaders do in times of crisis. This was taken from Training Industry website. It's very important to have a good communication. So chief nurses, supervisors, head nurses must keep a clear direction. When you say you will be on rest tomorrow because you have to stretch your schedule today, be sure you're telling the truth. Because other managers will not do planning and will just people whenever she feels she needed other people. So other staff are not able to prepare and plan for their lives. And then focus on people. During pandemic, the most affected one are people. So we must be people-centered, patient-centered, nurse-centered, because they are really deeply affected by this. We have to focus on people because they are because they are affected by the mental health issues, and should be able to explain ourselves to them, assure them that when they work, they are supported, etc. Sometimes, as a leader, thrown into the new crisis that is unknown and have never been charted before, like COVID, we need to find a coach because we are not all knowing, especially when it comes to values like what do we do to a staff nurse who's no longer reporting? Are you going to terminate, discipline her, or whatever? Because your nurses have mental health issues. Your nurses have family problem issues. And you as a corporate person, how are you going to manage that? You cannot tell them that don't bring your personal problem to the hospital. It's impossible. So to be able to relate to the people, because sometimes the values are clashing, you have to find a coach for yourself, for the leader herself. Be transparent, because that is for your integrity. Develop self-leadership. You take care of yourself. You lead yourself as well, because nobody will lead you. You are the leader. So you do your self-leadership. That's why you need a coach. And then more importantly, in time of crisis is you care for your team. Care for your team. Because if your staff do not feel that you care for them, it's so hard for them to care for their patients because they cannot give what they don't have. If they don't feel loved by the leadership, how can they love their patients? And then continuously learn to become a real leader. Over time, with great effort, you will become an expert in the field. Okay, so the last video, please. Okay, one moment. I would like to add this, that in every crisis like COVID-19, there is an opportunity. It is an opportunity to shrink or expand. So either the business closes or the business expands, or more models of this service units are developed, or nothing at all. So in crisis management, there are many new models that are discovered. Example, working from home. Work from home. Even if we go back to the regular times, we found that work from home is another alternative for us to save money, to save time, to save energy. I don't think the work from home will the practice of that, we will lose the practice of that when we go back to regular times. Except for those bedside nurses, some managers can go work from home once a week or twice a week. This is one of the practices that we see as an opportunity for improvement, and other else. And then the last video, I think. This is for the final takeaway.
Una, gusto kong sabihin na si William Osler, sinabi niya na ang mga nurses, the trained nurse, has become one of the great blessings of humanity, taking a place beside the physician and the priest. Meaning, siya ang nasa pagitan ng buhay at kamatayan. And this is a very significant role. Kasi nung araw, ang medicine man sa mga priestess, di ba? Sila high regarded. And the only woman, the only person who can stand tall between them is the nurse. And my message to the nurses, Kaiser?
Yes.
Okay, my heart is filled with joy seeing nurses working at the front line. Really, I admire your faithfulness to your calling. Kasi magkano ba yung sweldo sa ire-risko mo yung buhay mo?
Tama.
How I envy you. Oo, naiinggit ako. Because in my youth, I was like you. Ayan, naiiyak tuloy ako.
Walang problema po, Mas Marilu. I-express natin yung sarili natin.
I was always at the front line. I am sad now because of my age and physical limitation. I cannot join the young nurses in the mission. But my spirit is strong. And you nurses, remember, from the sidelines, I cheer for you.
Okay. Thank you very much. That ends it.
Thank you for a very meaningful lecture, ma'am. And now for the next part of our webinar, we will proceed to our open forum to give our attendees the opportunity to find out more about the topic. We will now proceed to the most engaging part of the webinar. So, a few words for our live audience. You may now input your questions to our chat box starting right now. We will collect these and address them to our speaker, Dr. Marilu Firu, to answer. Wow, so many questions, ma'am. Thank you for your very meaningful lecture, and we do learn a lot. So we have the first question, ma'am.
Okay, I'm listening.
How do you deal with staff nurse who wanted to resign in their post due to fear of acquiring COVID during the service? Thank you, ma'am.
I gave an example earlier that one nurse would like to resign because of COVID. So in my experience, what I did was to listen to her, of course, and understand her predicament. And then, as I said in my video, I gave her a time out so she could reflect, because it's so hard to replace her. There's a short staffing. So I can wait for her while she thinks, and then I would welcome whatever resolution she would have in her mind. So I would listen, and I would coach her how to arrive at the appropriate decision. And of course, we'll give her sufficient time to think. Because in normal times, we can be very strict, but not in COVID times. We need all the nurses that we need. But we should be a little lenient when it comes to their mental health, with their family relations, and others. Did I answer your question?
Yes, ma'am.
We should be, as I said, we have to focus.
Thank you.
We have to focus on the people. Focus on your team. This calls for greater humanity. Listen for them, and they have also needs. It's not only patients who have needs. Our staff have needs, and we also have to take care of our staff.
Yes, ma'am. Yes, ma'am. Thank you. Considering our compassions and responsibilities, how can we balance the support we can provide a healthcare worker to the needs of the patients and the organization?
Kindly repeat again. Kindly repeat the question.
Considering our compassion and responsibilities, how can we balance the support we can provide the healthcare worker to the needs of the patients and the organizations? I think the question is from our Chinese classmate.
Okay. The question is broad, but I can answer this by, compassionate management and compassionate patient care. We have to balance taking care of our staff and taking care of the patients. Because you see, during pandemic, our nurses have extended so much of their time. We also have to take care of them. We should also be compassionate with them. They are very tired. Now, with regards to safe patient care, we also have to take care of the patients. So what we are doing is to stretch the schedules to help the frontliners. And sometimes we announce that all hands on board, meaning all of everyone from assistant chief nurses, supervisors, head nurses, they are all at the bedside. We have to maximize staffing so we can deliver the necessary care to the patient. And then we do advocacy of the nurses in the MANCOM meeting. In every management committee meeting, it is the role of the chief nurse to articulate the needs of the nurses at the front lines. So something like increase in pay, hazard pay, accommodation, transport, and other things that the nurses would need to support them to stay longer at the front line. So chief nurses should be able to communicate well to the leadership, to the management, the needs of the nurses, because she is the bridge between the staff nurses and the hospital leadership. So that, because the leadership does not know the needs of the nurses, the chief nurses know better. So it is expected that she balances everything. She balances patient care versus staff management. And she recommends her interventions to the leadership. And leadership makes a decision.
Thank you, Dr. Ferrell, for your wonderful answer. And now let's proceed to awarding the certificates. Awarding of e-certificates. This certificate is hereby awarded to Dr. Marilo Ferrell for her utmost participation as a resource speaker for the 4-hour webinar event entitled Innovation and Current Trends in Healthcare Technology, Nursing Education and Practice, given this 12th of March 2022 at the Philippine Women's University, Manila, Philippine via Zoom conference and Facebook Live, signed by Mr. Herwin C. Calagno, our class president, Ms. Zenaida Kilakil, our subject professor, and our beloved Ms. Minerva de Ala, Dean of the School of Nursing. Thank you, Mom. Thank you.
Okay. You're welcome.
Thank you, Mom, for a wonderful lecture.
Okay. Let's proceed. It's my honor to introduce to you our second speaker. She is a registered nurse in the Philippines and in the United States of America, in Missouri and California. A graduate of 5-year Bachelor of Science in Nursing degree program in 1979. Higher education graduate of Crisis Management Clinical Specialization in New York, USA in 1982. Master of Science in Nursing Specialist Medical Surgical also in the USA in 1994. Master of Arts in Nursing Specialist in Community Health Nursing in 2005. Educational Management Doctor of Education in 2009. And currently working on her online class taking up Doctor in Health Administration at University of Phoenix, California. And has started but did not pursue to finish it yet. Doctor of Philosophy at Philippine College of Health and Sciences, Manila, Philippines. Has been a faculty member at Quezon City Medical Center College of Nursing from 1986 to 1989. Las Piñas Colleges from 1989 to 1990. An associate professor of Department of Nursing in School of Health and Allied Sciences at University of Missouri. She became a Dean of Naga College Foundation, College of Nursing from 1995. The Charter Dean of St. Mary's College of San Juan, Metro Manila in 2003, and the Dean of Palawan Polytechnic College, Puerto Princesa, Palawan in 2007, and continued to be the consulting dean till 2009. Dr. Obias was the founding executive director and community program development officer for Foundation for Special Children, Dysfunctional Adolescents, and Critical Adults age from 2002 to 2019. She started handling review classes for several review centers from 1988 to 2007 in Manila. From 1996 to present, she is the director for review and professor at New Manila Review Center, and also President Training and Review Director of Center of Review for Nursing, Obias Nursing Review Center, España, Manila. She has been a trainer of TB-MDR, TB, and designated head of the ICN Philippine Nurses Association World Program Partnership, ICN Geneva, Switzerland. She is previously the Philippine Nurses Association President, Manila Chapter, year 2004, 2005, and was also the chair of the Department of Nurses Welfare, Philippine Nurses Association National in 2018. She was also a member of the Committee on Chapter Affairs and Education National from 2014 to 2018. She is the representative of Philippine Nurses Association to DOH FDA as a member of the Technical Working Committee on ISO 10993 FDA CDRHR 2018 to present. She is a member of various organizations, a leader, humanitarian worker, an author of several books and manuals, including inspirational books entitled River of Life and Nursing Primer on Ethics and Values, and also a nurse entrepreneur. She is the founding member of Marian Devotees of Las Piñas City and was also a spiritual formator of Parish Renewal Ministry. She also served the church as a lector commentator, a multi-awarded nursing educator, guest resource inspirational speaker, currently the Philippine Nurses Association Governor for National Capital Region, Zone 1. Without further ado, to present current trends in nursing education, let me welcome Professor Dr. Maria Doris Rosales Obias.
Do I have the audio?
Yes, ma'am.
Okay, thank you. All right, good morning. Well, I am tasked to actually share to you a little of my knowledge and experience, of course, and of this current trends in our education and a little of the practice. Well, our health emergencies have indeed changed the world. It is not just in the Philippines, of course, but it is worldwide. Many have been affected by the changes. Total shift in our lifestyles, our goals, our work. This is not to say that the most affected in the shift are the healthcare professionals only. Nursing in particular, start careers with education. We have come to a point that having passed through a lot of challenges, this pandemic is the most challenging and unforgiving. Nonetheless, we have to admit our education is resilient and adaptable. Our nursing community is always on its toes to take up these massive changes. We never relent. I am here to add a little knowledge to our exposures on the current trends in nursing education. We have always been consistent in our thrust. Excellent education will always have, and good exposures will always produce a better nurse of tomorrow. This is not to say that attitude is a primary value that goes with it. Attitude is very important in education. Where World Health Organization has pointed out that what we have at least 28 million nurses worldwide. Yet that number is still not enough to meet the demands of the rising numbers of patients and to meet their needs. We do know that we have been seeing this pandemic. It is the test of time. And yet, despite this 28 million nurses, according to World Health Organization, we always say there is shortage of nurses, and that is very true. Again, according to the World Health Organization, the world needs 9 million more nurses and midwives to achieve universal health coverage by 2030. So now we have the roadmap from this time to the 2030 to meet the healthcare requirements for everybody and the needs of the patients. Philippines produces an average of 3,000 to 4,000 registered nurses every year to a minimum. But we had a lull in the past 2 years. Well, because of this pandemic. This made the pandemic more difficult because of shortage of medical and healthcare workers. Shortage is very glaring, and our healthcare landscapes keep changing. Again, the resilience of nursing community. Everyone faces the challenge with great anticipation. Let's start with our nursing education, where it all began. Let's share the screen, please. Can we share the screen? My report, please.
Yes, ma'am.
All right. All right. We now have the current trends. Nursing education is a professional organization. Professional education, it always undergoes continuous changes. The evolution is due to the changes of times and the challenges. Since it started, the evolution always gives rise to interesting challenges. Its dynamic change has been promoting growth and development of trends, some of which current trends have risen from general education, and some are due to changes. Exactly. Let's venture where challenges made massive changes in the nursing, not only in practice, but special education. Next slide, please. All things considered, we have always started with Florence Nightingale. We'll never be able to go through our nursing profession without looking back. Florence Nightingale, aside from having introduced to us the infection control by hand washing and clean environment, she has envisioned nurses as a body of educated women at a time when women are neither educated nor employed in a public service. Next page, please. The trends in our nursing education always depends on the evolution. During the time of Florence Nightingale, we do have numerous changes due to challenges. And these challenges, the practice of nursing starts with education, and these challenges actually gave rise to a lot of trends in our practice and in our education. Next page, please. These are the challenges. Look at this part. During the time of Florence Nightingale, she actually started the hand washing and the infection control. It gave rise to actually these theories of infection control. And she also envisioned that women should be educated to become a professional nurses. This is the time when women started going to school and being learned, and the skills were being honed as nurses to take care of patients. Now this time changes. As times changes, it also gives rise to trends. Right now, we are now at this time about this fourth picture. This gave rise to, still wala pa tayong lalaki dito. We do have women nurses, but it gave rise to male nurses. This is one of the trends that we actually have given rise to, because male now are nurses. There are male nurses now. The dynamic change have been promoting the growth and development of these trends. And one important concept is that nursing is an emerging specialty profession. As you can see, during this time of pandemic, this is another time wherein new current trends are again on the rise. Next slide, please. According to Mahatma Gandhi, education is the all-around drawing out of the best in child and man, body, mind, and spirit. A while ago, I heard Dr. Furio about the best that came out, the best of a nurse. It is true. In any time of the day, any time of the year, the best of what we have is being challenged. This time of pandemic, actually, this is you can say this is the time when each and every nurse, the best of them came out. But then again, the worst in other people also came out. These are one of the challenges that we met as nurses. Next page, please. Education is a multipolar process. It is influenced by modernization in different ways. Modernization means for us is the advancement in the science and technology, the changes that occurred and is still occurring in our social and cultural lives are the result of the impact of these advancements. Profession like ours, is a dynamic integration of various faculties of knowledge. Since nursing education is a professional education, it is dynamic by its own nature, thus giving rise to trends. However, there are numbers of issues and controversies that arises with its social, religious, ethical issues. As you can see, okay? We open up to a lot of opportunities, and these opportunities doesn't only mean in our education. It's only mean in our practice. In our practice, you can see a lot of opportunities that came out, and so did education. The opportunities that we had is, of course, we actually honed our being techie. The challenges that we meet actually opens opportunities. As educators, we had a lot of difficulties and challenges on how to connect with our students. This is also the time when we do not even know with ourselves how to communicate what we wanted to tell our students. That is why there is now the educator's toolbox that we call. This educator toolbox would actually help the educators, the instructors, the professors to be able to communicate to our students. Since the challenges of being able to hone the skills of our students is one of the in the highest echelon, then we have to make ways that our students will be able to master the skills that they are supposed to have an adequate experience to be able to handle a safe patient care. We do have in the high tech and the high touch. We now know that we are now in the technological advancement. We do not have any face-to-face. We do not have any experience going to our patient and handling the patient personally. But now we do have our technology. The investment of our administrators, of our schools into having this high technology for us to be able to have the experience as if taking care of our patients in the hospital. The simulators. So now we have the high tech and the high touch simulators. Next page, please. So first, let's start with identifying the flow of the trends in the nursing education. Well, let us not forget again that education is considered an important professional organization, systematically planned, implemented through instruction and discipline, and aims the harmonious development on the physical, intellectual, social, spiritual, and aesthetic power as abilities of the students to render professional nursing care to people of all ages, phases of health illnesses, in variety of settings, in the best of the highest possible manner. There are a lot of curriculum changes. The last curriculum that we had is the CMO 15, which is, of course, coming from CHED. It is the guidelines of the curriculum of all nursing schools. And that was in 2017. And there is another curriculum changes that is coming out. And so this gives rise to the innovation of teaching and learning. Again, challenges, especially its dynamism in it, gives rise to trends. Therefore, the innovation in the teaching and learning, there will always be a way for CHED, PRC, and ADPCN to have an educational quality assurance. They still have the ARPOT. But in these times of changes, they do have some changes as well. We, educators, well, of course, all nurses and all people for that matter that chooses technology relies specifically on technology now. We now have the high tech and the high touch approval. Next page, please. Let's start identifying the trends in education. We do have the curriculum changes, which rises in the development. We do have the innovation in the teaching and learning, which again gives rise to the innovation and ways of the professors to how to teach it. Then we are being controlled, not really controlled, but checked in our educational quality assurance by CHED, PRC, and ADPCN. Next page, please. The education more is reliant on high-tech, high-touch patient care, online programs, wall-based and computer-assisted classes. And of course, we have to focus now, considering that the decrease in the actual patient care access, we now focus on the output and the outcome base. So our education now also has an objective of the outcome base. Next page, please. Curriculum development in nursing education is competency-based. Everybody knows that. It focuses now on the output and the outcome. Well, almost a decade and two ago, it started with evidence-based research and processes. Still it is, but now we have the endpoint goal as realistic and competent care output. Since we know that students are unable to go on face-to-face and unable to actually attend to patients, the actual touch,
we now go to our innovations and our tech. Now, the students' participation in this, shall we say, partnership is the responsibility in learning. So innovation in teaching and learning is the use in technology, online program being used, web-based learning and computer-assisted learning. These are increasingly being used for access to education to promote intellectual, personal, and career development. The new normal education prepares students by providing the high-tech and the high-tech. Now, let us see the challenges of time. It has to provide more experiential learning opportunity than instruction. Increased use of the learning technology, more emphasis on the outcome-based than process-based, and more evidence-based education strategies and curriculum. Next page, please. Okay. The new normal in our nursing education. We start, as you can see, the current trends for the preparation of nurses. Prepare us for globally competitively competent, transnational and transculturally acceptable. Now, during our pre-pandemic, this is also one of the things that we do. But these are now one of the challenges. How can we be able to develop our nurses to be able to be competently, completely, of course, globally compete? How can we develop nurses to be transnational and transculturally prepared? Now, in the careerscape development, look at this. There are postgraduate courses and research. There are continuing education, training, and seminars. There is community immersion and organization team. These are all challenged. However, this is now the opportunity actually that gave a rise to the online based, which means to say a lot of students now are able to access education through online, which normally before, as you can see, our online education was offered by very, very few universities. Now we do have foreign nurses with us. We do have us as well have access to other online education. And it became a trend that education now, specifically postgraduate courses and research, and the continuing educations, trainings, and seminars are all in online and web-based. Then the credentialing. We do now have the advanced practice nursing, but of course, this is now pending in the PRC. Upon its approval, of course, we will start having this advanced practice nursing. But this, actually, the growth and development of nursing education was hastened by this pandemic. So we do also have the independent nursing practice. Next page, please. These are now, as you can see, we do have an access. We still have our postgraduates. We learn how to go into the learning, advanced learning through online. The continuing education, of course, is still online, but we do have the independent nurses. We do have traveling nurses. We do have specialized nurses. Now, all of these are now accessible because of our online and web-based education. Nonetheless, the objective has always been focused on the outcome-based learning. Next page, please. Therefore, after this use of opportunities that we have, creativity, high technologies, comes the reality of the trends we will expect in 2022. As you can see, pedocentric, the students is the focus of the present-day education system. Since we have difficulties in allowing our students to go on face-to-face with the patients, we do have the challenge in how to hone exactly their skills. Now, teacher's role, as you can see, the pivot or dominant figures of the teacher practically disappeared. Before, when we had the classroom setting, the learning process and the teaching, it pivots around the teacher. Now, it is on the student. Then there is the activity-centered, the outcome-based again, which is our eventual objective. Then the creative education, blogs, Twitter, social media. Surprisingly, that was only being done during the time when we are in vacation, when we wanted to connect outside of our school. But right now, the trend is educators, professors, teachers do connect with students through this social media. Then more community participations and the advocacies enter this, and the reliance on technology and the web-based increases. Next page, please. As you can see, a while ago I was telling you about educators' toolbox, the teaching innovation and the creativity of teachers. We do have now the blogs, okay? The blogs, teachers use the blogs to post probing questions for the week. Review learning for the day through tweets. Make boring topics more easy to retain and comprehend by using parody of hit songs they enjoy and follow. These are students that we're talking about. Create infographics as a review with memes, of course. It's very easy to comprehend and retain if we do have the memes. Go paperless for a week. Limited face-to-face, following strict protocol into the web, and have no tech day. As you can see, we do have, since we are in the web base, we will now have no tech just for nostalgic reason and make it more interesting. Since it's been a while that everything depends on gadgets, when we do have face-to-face, let's get out of this technology. And then we also have create your own hashtag. Next page, please. That is for emphasis. Next page, please. A nurse, after observing, listening to patrons, a nurse finds out in discussion the patient's unmet needs. We would be expecting more community participations. We will increase acceptance of non-formal type of education, which is the new normal. We will now restructure the traditional programs. If not at all, we did restructure our traditional programs already. We combined the web-based education and a face-to-face. I believe we do now have the face-to-face. So we combined, because of the numbers of nurses and because of the numbers of students we have in the classroom, we divided them by numbers. Some will be on the online and some will be on the face-to-face. But eventually they will have the same set goals, outcome-based. And we increase opportunities for higher studies. Next page, please. Nursing education is changing with technology. This is expanding with online classes. We do have patient simulators and other tools that made education more accessible. We have creative collaborations that help solve problems. We have design thinking. This is actually not new, but we just have to put it into words. We were doing this already before, but we just have to put it into words. Design thinking approach is to foster innovation. Design thinking teaches students how to challenge their own assumptions to better understand patients and their needs to create quicker and more effective. This is interesting because design thinking we just have to put a name into it. We have been doing this already, but let's look at the 5 phases of design thinking. Next page, please. The 5 phases, the discovery. We do actually have to listen, see and listen to the needs of the patient. That goes with us professors, teachers. We have to listen and look at the needs of our students. Next, of course, is the interpretation. We do have in our practice interpreting the needs and the concern raised by the patient. We also have to interpret the needs and the problems of our students. It is actually in actions and through listening that we will be able to interpret. We do have the ideation. Ideation is the formation of ideas and concepts, development of innovative ideas or actions to improve quality instructions. Now, I was mentioning a while ago of the blogs, of the tweet. These are all innovations that made the teachers connect to students. And the teachers actually make it interesting to the students by using the technology to be able to connect to them. Now, in the practice, this is also all being done also because the needs of the patient is being actually, when we go to practice, we do have the objective and subjective science. We do have take note of that. Then we put that actually in, we have to comprehend and make some solutions to the problem, as you can see. Now the experimentation. Now we have to implement our ideation. The professors actually implemented what they have actually made or innovated in the education. Now the evolution. This now completes our new trend. The new trend that we have actually right now is this: we are able to connect the trends of being able to be in the internet, to be able to teach online, which is web-based, to be able to connect with the students, not in front of us, but in the computer. These are all actually, this is now what we're saying, the trend. Okay. Evolution is the completion of the change. Now, next page, please. Design thinking and learning. Listen, gather facts, think of solution and problems of unmet needs, give values and importance to patients' complaint, needs, or students, come up with a solution. Now we have the blogs, the tweets, and all, and create a better patient care and protection for community. Next page, please. Let us see this. Let's make it an abstract way of being able to get through this. Let us capture, okay? Let us now capture, gather information. When we gather information about the problems, the solution, we dream or we innovate, we make solutions. Then we explore the values. We explore better possible ways of solution to problems. We build the foundation of results. Next page, please. Next page, please. We build the foundation of the results. As you can see, we did have the planning and everything else. When we make the abstract of it, we were able to implement it to our students, and we were able to have it in a program and reproduce the students according to the skills we wanted to communicate. Please. Now that is being cascaded to the community. The skills of the patient, though we have always been apprehensive that we will not be able to give the students what they actually need. That's not true. We do have the innovations that we make use of, and the technology, and the teachers were able, and the administrators actually were able to provide us with our advanced technology. Next page, please. To present challenges and issues. Well, of course, this is the reality of it. The continued matriculation despite crisis. The traditional classroom-based educational program to web-based programs. The academic preparation of adequate numbers of qualified nursing educators. As you can see, when the pandemic started, everything was in chaos, not only in the practice, but also in education. For a while, we did stop because we actually do not know what to do next. Therefore, but through these challenges, again, the innovation came in. So how do we prepare not only the students, but us teachers? A lot of us were not even techie. I am one of them. I wasn't even prepared to go into online. Well, of course, my review center were going online even before pandemic. I already have online. But nonetheless, during this formal education that we're trying to hone on our students, the skills we try to hone, we were never prepared for this. Therefore, practically one of the problems was the qualified nurse educators. Then adequate preparation of the nursing students, both academic and actual duty class. Next page, please. On the other hand, adequate preparations in meeting of the new normal that entails handling education and care through technology. Adequate preparations of the registered nurses to meet the growing healthcare demands. Do we have actually prepared nurses and registered nurses to meet the growing healthcare demands? Next page, please. Due to this pandemic, the recognition, growth, and acknowledgement of nurses' specialty profession was hastened. We now have the pending, I already mentioned a while ago, because nursing is an emerging as a specialty professional. Next page, please. Before, we are actually considered as an ordinary general healthcare provider, the general care. However, due to this growing continuous changes and pandemic, it also hastened the growth and development of nurses as specialty professionals. Next page, please. Let us try to focus now on our school fundamentals. Schools of nursing objective is always to produce nursing professionals that are clinically competent, can contribute immensely to the provision of quality and safe nursing care. That is why we do have the quality control or the RQAT, because all schools are being evaluated if they are able to give a quality education to produce a quality professionals. Okay, next page, please. Quality, our nursing education program can only be qualified as and classified as excellent or high quality if it can be rated with at least 80% in all criteria used in its assessment, following the CHED, the PRC, the 80% quality assurance. However, one of the popular bases in gauging schools' quality and education is the passing rate of the licensure examination. You know, I have always been very, very proactive on this. I would not say that the school is that good, but having a 100% passing rate of a school's licensure examination examinees is a high gauge that the school is functioning very well. But in having a top-notcher, let us give the credit to the students with the aid of the professors and the school. So top-notchers, the students and the professors, the 100% to the school. Next page, please. Quality of nursing education has been strongly associated with the quality of the following. Well, the nursing education can be attained if nursing faculties obtain a balanced experience in theory and clinical practice. Vast knowledge acquired and focused on may result in the nurse force that can apply the theory and lessons learned in the simulation laboratory, which means to say the resources into the delivery of the healthcare in everyday living. As you can see, the curriculum is very important. This is based on how the student, how the school is able to go guide the students. The faculty profiles, yes, this is very, very important. We do have really good professors, even if they are not actually, shall we say, having the highest educational background that we have. But there are a lot of professors who can connect easily with the students. These are the good faculty professors. They may not have the doctoral degrees, but they are able to connect with the students. These are good professors. Then we do have the resources, and thanks to the schools that take care of us, we do have the technology in the laboratories, in our libraries, and other physical resources, which means to say that we now have the simulators. Now we do have the teaching materials and the facilities that, again, our good schools have provided. Next page, please. We do have good learning materials, yes, human resources, help of people outside of our, shall we say, department is very important. Then the teaching and learning process, curriculum, teaching and learning experience, the clinical, and the teacher's attitude and commitments. We do not only have the students being committed, but the professors. On the other hand, next page, please. Next page, please. On the other hand, no, go back to the last, future, yes. On the other hand, the issue of quality of nursing education program in Philippine colleges of higher education is extremely sensitive. In Philippines, due to the high number of trained nurses that we export to other countries. The quality of nursing education program has been strongly associated with the quality, again, of curriculum, faculty, etc. World Health Organization has affirmed some standards, criteria of area that quality of nursing education program should be measured with. Faculty profile development is included. This activates the discussion into whether the quality of nursing education program is hinged on the profile of the faculty. Now, let's go to the future challenge for nursing. The expanding technology. We do have to really actually relate ourselves and attach to this technology because it's not going home. It's not actually going back. We move forward. Okay, the computer assistance education, the new threats to health. Yes, there will be, no one can say that there will be another threat to health. It may be the mutation of our present virus, or it may be another threat to health. Nurses enters a private practice. Agree. These new trends actually made a lot of changes. Nurses entered a private practice. The change of role and image, of course. We are not only nurses, we're also entrepreneurs. The nurses, well, of course, a lot of nurses are actually very tired that they are unable to go into business. But some of them also have the chance to go into business. And some of them also became, well, more time with the family. Okay, the collegiality among health professions. Yes, it's one of the things that I remember before pre-pandemic, that there is always a collegiality in all the doctors, but not with nurses. We never had actually the collegial relationship. Well, of course, we're friends with the doctors, but they never actually really gave us that responsibility of being part of the team, except to take care of our patients. But this pandemic times, we saw with all honesty that doctors depended on nurses. Okay, next page, please. Educational preparation, the building towards unity. Yes, I already mentioned. Unification of practice and education, of course. Since we are now in this high tech that we call, we should connect our practice. We should connect our education to our practice. Then self-governance. We do learn how to learn without the professors. We do learn how to be creative ourselves, to be able to learn without the professor and be able to relate with the professor because of these challenges. Now we have this another future challenge, the recruitment of the best candidates into nursing. Are we able to promote or are we able to produce a really best candidate for nurses? The lateral mobility for nurses, yes. We now have a concurrent and we now have a lateral mobility. The jobs, the works of nurses are being now not being challenged, but being diversified. Next page, please. During these challenging times, we have to expect entering this year of 2022. Students need to be more techy, of course, that has already been there for about 2 years. Nurses are required to adapt to these technologies to improve patient care. Yes, this is one of the things that we actually have to be worried about because, as you can see, being able to be in the simulators is very much different from our actual handling of patients. Nonetheless, the skills are being honed in the simulators, yes. But our empathy, our caring side is not being developed very well because our compassionate and empathic side is only being enhanced when we actually touch our patient. That is where we have to work on and so much. Now, in being techy, we now have a lot of technological in the hospital that we should learn. We do have the laptop charts to document and obtain patients' information and treatment options when necessary. We do have the laptop. Before we have to go to the nursing station to be able to chart. Now we do have the moving station workstation. This is the intuitive workstation. It is on wheels and it is increasingly popular. I really do not know which of our hospitals are now using that, but that is one of the trends that we have in the hospital. Now, in the education, that is not no different because we do have to practice in that because we do have the laptop with us all the time. Next page, please. The increased mobility in nursing equipment in the hospital cart, which of course that can move. Well, this thing that self-care for nurses is something that we will have to take note of. Nurses are trained caregivers, yet they forget to take care of themselves. This should start in the school. We have to take care of our mental health. We have to take care of our students, telling them to love themselves first. We are to repeat, there's always a saying. We always repeat this. We cannot and never be able to give what we don't have. We never learn how to take care of yourselves. How can we take care of them? We never learn how to love ourselves. How can we know what love really is? But that is not to say that that's very easy to do. Yes, it is not. But we have to understand that when we are into the practice, we're now trying to have our difficulties in the education. We will have more in the practice. So there is also an increased specialization and career path options. The career path options, we now will be able to look at it later. Then there is a comprehensive nursing law of 2019. Yes, the comprehensive nursing law of 2019 is, we do have, shall we say, this is being amended now. This is being amended now by the Philippine, no. This is the amendment for the Philippine Nursing Act of 2002. This is now, the Comprehensive Nursing Law of 2019 is now the amended, but this is still to be approved by the Senate. This is still to be placed into law. But this is now the new Comprehensive Nursing Law, amended the Philippine Nursing Act of 2002. Okay, other options in the career path of nurses are actually endless after this pandemic. Next page, please. The traveling nurses. If you remember, that there were times when in Visayas needed actually nurses. Some of the NCR nurses were brought there. That is considered a traveling nurse. It is now here to stay. Who can say that we will not even, when we have reciprocities with other Asian countries, which that is being under works right now in ASEAN? No, we can send nurses to Indonesia, to China, to Japan, to anywhere in Asia, and came back after several months because that is only reciprocities. See, that is traveling nurses, and it is here to stay. Nurses are retiring much later. Well, our retirement is 60 to 65, but I don't think so. Well, I'm 65 and I don't intend to retire yet. The online nursing education program, the increasing need for nursing educators. Yes, let us get trained and let us teach our students to be good nurses. Increasing number of nurses changing fields. Yes, salaries and benefits will have to increase, especially in the private. We already have the increase in the public, but hopefully we will have an increase in the private. Now we do have the bilingual and multilingual nurses will soon be in demand. I believe we do have Chinese nurses here with us, and that is a very big disadvantage. Learning how to speak English, learning how to speak Chinese, learning how to speak Japanese, maybe learning how to speak Italian, Spanish, and the rest. It is actually a very, very good way to be, because we will be in demand. Next page, please. Males. I mentioned a while ago, there are a lot of males now in the workforce and will increase exponentially. Holistic care will become more popular. This is not just going to be taking care of the head, of the pain, of the breast. This is going to be holistic. You're going to take care of the mental health of the patient, the spiritual health of the patient. That is why it will now start in the classroom. Patients will become more educated. Yes, we are now going to be challenged. Therefore, we should always be prepared. Students should always have an adequate education that they will meet patients that will be well educated. Next page, please. As you can see, we do have the technologies, the moving. This is what I was talking about a while ago. The moving station, the laptop, you move. You can access all information without actually leaving your patients. But it turned out that patients that I mentioned a while ago about being burned out, taking care of yourself. And the traveling nurses and the advanced practice nurses and our access to modern education through our technology. Next page, please. Yes, this is the traveling nurses, our access in the computers. We will actually be advantageous. Actually, we can say that we have a lot of challenges, a lot of changes, but actually it is for the good. We now become diversified. We now become, shall we say, endless in adding opportunities because of the challenge that we have. Next page, please. Facts and figures. I'm into my last. In 2030, the world needs 18 million more healthcare workers to meet the requirements of universal health coverage, 6 to 9 million of which are nurses and midwives. Globally, 70% of the healthcare and social workers are women. In 2020, we celebrated the Florence Nightingale 200th year birth anniversary. She who helped shape the nursing profession. Next page, please. In her career, Nightingale changed the way nurses were educated, how society viewed the nursing profession. In the same year, the April of 2020, the first ever State of the World's Nursing Report, put together by World Health Organization, was released. Projected starting 2022, the nursing profession will become more attractive and patient experience will play a significant role in the decision making. I already mentioned this. The patients are well educated now and they want to control their own health and they wanted to know what we know. That is the reason why design thinking is now the trend of doing the patient care. Although rewarding nurses can be, next page please. Similarly, patient satisfaction will play a role in these changes as well. This decade, we will find a significant change in the landscape of not only nursing practice, but education, but with the healthcare industry as a whole, considering the challenges and massive changes in the face. At this point, trend will continue to appear as, next page please. The landscape of life, no matter the social, the status challenges have always been met with different actions and reactions. All this create changes. It is only you and I that can make a difference. I believe we made our choice. Next page, please. The choices that we made. Nurses can only give what we have. Our complete cared self. So nurses, take care of yourself. Love yourself. There is a popular saying, we cannot give what we don't have. And it's here what I can say. Next page, please. This is what I can say. The twin nurses actually, when we honed ourselves because of these challenges, we actually became heroes to a lot of people. I remember very well when I was invited in a career path of one of these schools. I was a resource speaker for the career path of one of the universities where my 3 boys went. They graduated, they studied and graduated in that university. And I was one of the resource person. And one of the things that I told, and now one of the things before I ended, is a question I threw to almost, well, of course, more than 300 third-year students coming in for 4th year. One of the questions I said is, why don't you join the heroes of the times, the saints of tomorrow? Well, that was 2 decades ago when I said that. And now it became true. Nurses are actually heroes of the time, saints of the future. And that begins in our education. Thank you.
Thank you, Dr. Obvious, for sharing your expertise with us. Okay, one of our participants just raised a question for Dr. Obvious and came from Mr. Leonardo Maestro.
Hello, sir.
Kudos, Dr. Doris, for very much informative discussion. Despite efforts of schools and universities to adopt strategies for the new normal education, student feels too overwhelmed and too stressed with academic requirements that most of them demand breaks. Are there best practices in relation to this? Best practices that address students' mental health and better coping? Thank you.
Yes, one of the best practices I would be able to do, well, I would start with the self-care, okay? Other than before I say about the best practices is the self-care. As you can see, in these times of pandemic, or well, the pandemic is now to end, but who to say that there will be another threat in the health, no? So before we can even be able to adjust, we do have to understand that nurses, once being subjected to stress will always have mental issues, will always doubt. Doubting oneself and giving up on oneself is one of the things that we should realize, that we will not be able to cope if we do not take care of ourselves. One of the best practices that I will be, well, of course, pointing out is the educators being able to connect with, being able to adapt with the innovations and being able to connect with the students through their own ways. I was able to mention about the innovation. One of the things that you're able to do was using the social media. Although, you will have to have a private social media for this matter, using the blog, using the tweets, using a parody to be able to communicate as a memes. No, we do have memes to be able to allow the students to remember or retain those difficult things that we actually being able to convey to them. They are having difficulties because of all the stresses. Now, the innovation of the teachers being able to impart are one of the best practices that I can say that they will be able to partake. Thank you, Sir Leo.
Thank you, Dr. Obias, for that wonderful answer. And now, let's proceed with the awarding of certificate. Okay, this certificate is hereby awarded to Dr. Maria Doris Rosales Obias for her utmost participation as a resource speaker for the 4-hour webinar event entitled Innovation Current Trends in Healthcare Technology Nursing Education and Practice, given this 12th day of March 2022 at the Philippine Women's University Manila, Philippines, by Zoom conference and Facebook Live. Signed by our class president, Mr. Herwin C. Calagno, Ms. Zinaida Kilakil, our subject professor, and our beloved Dean, Ms. Minerva de Ala, Dean of the School of Nursing.
Thank you.
Now for our third speaker. He is a graduate of Trinity University of Asia, St. Luke's College of Nursing in 2005, a graduate of Master of Arts in Nursing at Trinity University of Asia, Graduate School by the year 2011, and Doctor in Nursing Management in the same school by the year 2017. He worked as a clinical instructor to the following schools: AMA School of Nursing from 2006 to 2007, Far Eastern University Institute of Nursing from 2008 to 2009, and Our Lady of Fatima University Antipolo campus from 2009 to 2010. Trinity University of Asia Graduate School from 2017 up to present. He also became a staff nurse too at Philippine Heart Center from 2010 to 20. A nurse 5 assigned as manager in the medical surgical unit from 2018 to 2021. In the same year, he became an officer in charge in Medical Surgical Care 1 from March 2021 to July 2021, and currently, he is the division chief of the Medical Surgical 1 from 2021 up to present. Aside from his clinical and educational background, he was also active in the different prestigious organizations in his chosen field. He is a member of Sigma Theta Tau International Honor Society, USA from 2018 up to present. He is also the certified assessor of DOH Nurse Certification Program. He is also a member of Society of Cardiovascular Nurse Practitioner of the Philippines from 2011 up to present. He is also a member and certified IV therapy receptor of Association of Nurse Service Administration of the Philippines, Inc. from 2017 up to present. He is a former elected board of director of Philippine Nurse Association Zone, Syracuse Marikina chapter. He is a vice president of St. Luke's Trinity College Alumni Association from 2018 up to present. He is the president of the Nursing Service Employee of the Philippine Heart Center from 2019 up to present. He was a fellow of the Royal Institute for Nurse in Singapore last 2018. He was also a certified hospital administrator, fellow in hospital administration, and a member of the board examiner for oral examination, Philippine College of Hospital Administration. Aside from this, he was also fond of doing researches as principal investigator, co-author of numerous researches both in hospital and in graduate school as advisor. Due to his expertise, he was invited by numerous institutions as a resource speaker, and he is a regular lecturer for the Philippine Heart Center in Health Continual Education, Philippine Nurses Association, and the Association of Nursing Service Administrator of Philippines. A distinguished nurse, educator, and author to discuss leadership in times of pandemic include best practices, effect of COVID-19 to nursing education. We may now call on Dr. Joseph Peter B. Ragandola.
Thank you. Thank you for that introduction. Okay, please allow me to share my screen. Okay, can you see my screen?
Yes, Doc.
Okay,
Yes.
thank you so much. Before I start, I would like to give my sincerest thanks to the Philippine Women's University, to the organizing committee headed by Ma'am Sinaida Kilakil, a very good friend of mine. Thank you for the opportunity to share my insights and thoughts regarding the topic assigned to me. So I'm tasked to talk about leadership in times of pandemic, both sharing of practices for service and education. Actually, if we're going to analyze the first speaker, Dr. Purier, and second speaker, Dr. Obias, I will merge it in terms of my presentation. Okay, COVID-19 pandemic, who would thought who are being in this situation 2 years ago, especially with the pandemic right now. So all of us are not prepared in terms of the facility, reconfiguration of the facility, in terms of the policy, in terms of managing our people, in terms of the flow process, in terms of the patient care, in terms of adaptability, in terms of technology, both for clinical and education. I think most of us are not prepared during the March 2020, 2 years ago. No? Do you still remember these dates? We will never forget these dates. By the time the World Health Organization declared as public health emergency of international concern last January 30, 2020, that's 2020. And by the time that the World Health Organization declared officially pandemic during March 11, and several days after, the Republic of the Philippines placed the entire Luzon and other areas on enhanced community quarantine, ECQ, on March 17, 2020. I remember all of these dates, all of this scenario, especially in the clinical area. A lot of chaos, in terms of managing the people. We're not prepared, actually. There's a lot of chaos. There's a lot of fear and anxiety, especially in the front line for our nurses. But what actually this pandemic taught us is to be able to transform us, to better us, no, in terms of the competency, in terms of potentials, in terms of managing the entire organization, managing our people in terms of this pandemic. Okay. So I would like to actually know your insight during the day one of the pandemic. Please type in your chat box in terms of hashtag word that comes to your mind during the start of the pandemic. I will appreciate if you will do that now in terms of the hashtag. What came to your mind during the start of the pandemic? Okay, we will see that later. Okay, now for the service, no, I will start with the service. The pandemic is abrupt. Actually, it was started a news February 2020, started in Wuhan, and then eventually a series of events happens all throughout, and the rest is history. We're not ready, actually. Who would thought all of us will face this situation? But of course, a lot of reflections, a lot of lessons in terms of managing the situation came in after this pandemic, and a lot of changes. They say in terms of fluid, the policy changes abruptly. We have a policy, for example, on the day, and when eventually it will change over time. So in terms of adaptability, in terms of cascading that changes, that's also served as a predictor in terms of getting confusion and of course anxiety to our people. Now for education, this pandemic actually geared all of us in terms of the online platform. Of course, in preparation for the online platform, there's several trainings, but this is instant, okay? We have issues in terms of connectivity and bandwidth, and of course, preparation in a classroom-like environment in this online platform. Now, what is the effects of COVID-19 to service and education? Of course, we need to adapt. Adaptive leadership. No, we need to adapt. We need to face. We need to function, and we need to move forward. No, regardless of the situation. So reconfiguration of services, in terms of policy, in terms of facility, in terms of flow process. We need to actually face all of this in terms of the pandemic. Nevertheless, we need to move forward in addressing all of this issue. This is fast evolving information policy guidelines, no? Napaka-fluid ng policy, no? It changes abruptly. And again, in coordination with the different recommendation from the expert, Department of Health and WHO, and some of the best practices, we're able to manage in terms of the policy guidelines that guides our people in the front line. For example, as simple as admitting patient, what is the usual process, pre-pandemic and during the pandemic. So we need to settle a lot of this. No? In terms of facility, we actually cater several floors in terms of handling COVID patients. That is labeled as hot zone or danger zone. And of course, we need to actually face the primary goal of the hospital and us nurses, no, in giving care to our patient regardless of the situation. So the demand of patient care and other services should still remain, no, despite the crisis. In terms of education, in addition, there's a physical education shutdown, all of us geared towards digital platform and online training, and of course, adaptation of information technology in education right now. No? So in terms of nursing leaders, in times of pandemic, I have here simple illustration in terms of the principle of leadership in a crisis. So communication is the key. So communication is vital during the crisis. So we need to actually meet our people, our managers, cascade it down the line to our people so that we can have the same language, because anxiety actually contributed to less information, no, in terms of policy. Decision making is very important. We need to be decisive. I remember one of my readings, no, the first best thing that you can do is to do the right thing. If you have the ample time, you can do the right thing. The second best thing that you can do is to do the wrong thing. Of course, case-to-case basis if you don't have the luxury of time. And the worst thing that you can do is to do nothing. So as a leader, we need to do something. Despite the pandemic, despite the many challenges that we are facing, our people is looking up to us. We need to decide. We need to do something. Of course, leading with compassion, need to innovate this regardless of the situation. And of course, the core values of the organization. We need to be aligned with that all the time. Okay, please take note, no, that as an organization, we need to acknowledge reality. Okay, pandemic is here to stay, and we cannot get away with that. Although it's a good news for us, no, in the current times that we are in alert level 1. But then, of course, we are still catering COVID patients, and still there's a lot. Actually, one open unit allotted for COVID. So we need to acknowledge reality for us to plan. Okay, don't panic. Okay, the one of the initial reactions in terms of a crisis is in terms of chaos, anxiety, fear, no, but that's normal, no, in terms of the initial reaction. But as you proceed in terms of planning, in your vision for the organization, the nursing service, your people actually, you need to be guided with your principles. So you need to have concrete actions and solutions. And by doing that, you need to have a whole mind, no? Complete mind, physically, emotionally, holistically, preparation for us to plan. Communicate open. Based on my readings, a lot of literature will tell what is the best practices during the pandemic. Communication is the key. All of the readings that I made in terms of the literature, communication is the key. Most of our nurses is having their peer anxiety during the day one. I remember a lot of chaos in terms of, for example, admitting patient turns out to be positive and they are exposed actually. A lot of them are actually inflicted with the disease. And sad to say, we have statistics no, in terms of mortality. So communication is the key in terms of cascading information from top to bottom. So that's actually very important in terms of crisis leadership. And of course, take responsibility. So a lot of people will look up to you as a leader. So you need to decide, accountability and responsibility came in. And of course, leading with compassion, we need to listen and be sensitive enough for our people in terms of this pandemic. Actually, we welcome a lot of query and issues and concerns in terms of in line with the different arrangement of policy, because we need to abruptly change policy based on the situation, a lot of that scenario no, in terms of clinical practice. So in terms of leadership in a pandemic, we need to plan. Okay, we need to plan, anticipate the plan for the worst. Okay, actually in terms of contingency plan, we are anticipating future pandemic in the future. So you need to have a plan for that. Of course, we need to manage our resources, our people, no, efficiently and effectively. Okay, basing on the data. Of course, I will share later what we actually do in terms of the practices. Okay, and of course, again, communication, no, cascading of information, communicate regularly. Although during the day one, we actually meet face to face still, of course, with social distancing, and in observance with the policy of the IATF in terms of the recommendation, of course, we utilize the online platform. Remotely, some attended remotely in terms of the participation. Okay, because we need to actually inform our managers, we need to inform our people in terms of the latest innovation, latest updates, in terms of latest changes, in terms of the policy. Okay, and of course, we need to empower our people. Okay, we need to empower our people despite the pandemic. We need to have that ownership in them. Okay, of course, they have fear, they have anxiety. All of us have fear during the pandemic. No? What to expect, admitting patients no, with COVID. Before, there's no still vaccination and no actually latest updates in terms of management, in terms of COVID. So we need to empower and ownership and allow to grow in terms of our people. And of course, in terms of feedbacking, listen with the heart. No? As a manager, as a leader, you need to have sensitivity in terms of actually listening to them, in terms of their issues and concerns, okay, so that we can address that, okay? And then I have here acronym. This is actually, you're going to search the literature for actually the best practices for the service. Based on various literatures, I have this pre-cell. Okay, P for the plan. Okay, we need to plan. That's very vital. No, we have very favorite quote. If you fail to plan, you are planned to fail. Something like that. So as a leader, as a manager, that's our armor. We need to plan right away and anticipate worst scenario in terms of the pandemic. Okay, when we plan, we actually involve our people. Okay, that's a two-way. So we need to get their inputs in their respective units, divisions, departments, and the entire services. Okay, responsibility and accountability. Okay, as a leader, we need that. Okay, and of course, communication and information. I will merge this two. in terms of cascading to the entire organization from top down, no? In terms of our people. Because during that time, again, as I mentioned a while ago, we actually changes policy, protocol guidelines very often in terms of basing the recommendations, because we don't have actually guidelines for the COVID during that time. So actually you are basing with Bushon, okay? And so we need to empower our people so that they can be strong enough to face this situation, okay? And lead with compassion. That's very important. Being in the front line is not easy. I salute to all nurses, catering, working, no, from day one up to this time. Salute to all of you. So we need to lead with compassion. We need to lead with the heart. We need to hear them. We need to acknowledge their fear. We need to acknowledge their issues and concern. Okay, and of course, listening. It's very important. So what we did in terms of addressing pandemic during that time is, of course, assessment and then planning. During the assessment, we have data analysis in terms of statistics, census, something like that. So later on, I will going to share what we did in our institution in terms of the practices. Of course, communication. Hindi mawawala ang communication. Laging nandyan ang communication. And of course, plan and execute. And then, actually, meron pang karugtong yan. Evaluate. If it's not working, replan. Something like that. So we have here, again, we'd like to highlight the core competencies in terms of leadership in a crisis. So we have communication, connectivity, you connect your people, okay? Courage and perseverance. You must stand up, no, as a leader. Because a lot of people will look up to you. That's our leader, something like that. Credibility, of course, in terms of decision making, we need to decide. We're talking here about urgency. We're talking here about timeline. So we need to decide. Okay. Emotional effectiveness, integrative thinking, and of course, baseline data in terms of situational awareness. Okay. So the international pandemic of COVID-19 is unprecedented. We never expect that. But we are hearing again news during February 2020, and the rest is history. Nurse leaders play a pivotal role in balancing the needs of their staff with the needs of the patient. So as a leader, we are looking into scenario, managing our people and managing our patients, because we're in a service facility. Maintaining one's moral compass during the critical decision time is the most important part. We need to decide basing on data, basing on the right perspective. Sometimes we are deciding or having decision unpopularly, but I'm sure people will understand in terms of that decision because we are basing in terms of data. Okay. Crisis leadership requires communication, again, a clear vision, values, and caring relationship. So that's relational leadership. Nurse leaders often make decisions in an environment of conflicting data and directives. So you need the help of one another, team leader, team effort. Nurse leaders must harness respect and goodwill by overcoming current challenges. And nurse leaders must develop and mature the skills necessary to quickly identify and effectively respond to crises. So again, all of us are actually novice in terms of leadership during the pandemic, because this is the first time that we actually facing the pandemic. But again, sooner or later, we are all experts in terms of managing our people, managing the entire organization with the help of this situation. That's actually a lot of things came out with the pandemic. No? So aside from seeing it as a negative one, we are actually seeing this situation with a lot of opportunities and positive thing that happens during this time. Okay. So in other definition or other concepts, to minimize the negative impact and of course to maximize success, you need to actually still achieve the goals, achieve the targets of the organization. Okay. Communication that is truthful, mindful, and relevant, direct to the point. one of the competencies necessary to accomplish this. So global COVID-19 pandemic has challenged healthcare leaders. Okay, I myself actually experienced that everywhere to rapidly address large numbers of quality, safety, patients, family, and workforce challenges. There's a lot of challenges in terms of patient care, managing our people, the facility, the flow process, the operations, the guidelines, the SOP, etc. As a leader, you'll find yourself having to manage your way through and out of a crisis. So again, in terms of planning for the next pandemic, no, anticipation. So we need to get yourself prepared as an individual. Okay. So the threat is evolving. I remember during that time, the worst is coming, no, in terms of statistics, data, the Delta variant, the Omicron, the mortality in terms of our frontline, both for the medical and the nursing service. So a lot of that create chaos and fear, no, to all of us working in the hospital, but not just in service, but also in the academe, and a lot of us experience. This doesn't mean that leaders need to become overnight epidemiologists. We leave that to trusted government and medical authorities. So what I'm saying here is that we need to understand the situation. We need to update yourself in terms of the different information that's coming out in terms of this pandemic, so that you can plan, you can have a good decision in terms of the planning. Okay. So again, plan and be ready to shift gear. Okay, be flexible. In a phase of crisis, quick action can keep a crisis from escalating, minimizing the effect of that situation. Okay, it's imperative to act both quickly and deliberately. Work with your team. Right away, we managed to have session with the managers and the entire team in terms of how we handle the situation. Baseline data in terms of staffing, in terms of operation, in terms of the overall plan for the entire services in terms of nursing. So one of the literature that I included here is that based on Harvard Business School, researchers found that most successful teams cycled among different ways of working alongside with your team to monitor work and apart to see a big picture. So as a leader, you continuously monitor, adjust, and even reformulate. This is what I'm telling you a while ago. If the first plan doesn't work, we need to replan. We need to reformulate our plan. We need to shift our gear, you know, in terms of the output. Be ready and willing to actually prepare for the inevitable. One step forward, two steps back. So something like that in terms of the planning. Communicate often and early. During a crisis, there's typically a lot of noise. No? I tell you, there's a lot of chaos, anxiety, fear, but we understand that. All of us experience that during the pandemic. But make sure that your team understand day-to-day what they need to do and why. So communication is the key. So address the team concern directly. So don't actually contribute to the situation. Be a part of the solution, something like that. So when delivering difficult news, be direct and honest. Be honest and direct to the point in terms of cascading the information. So right now, for example, right now we have a total census of this one. We have nurses with this one inflicted with a disease. So basing on the facts, actually, establish a routine communication schedule so that you can actually meet with your team. Okay, for example, if you're meeting your managers, you're meeting your other people in terms of cascading information, so you need to have a schedule for that. So a communication during crisis is very important. Communication should be two-way. This is also mentioned a while ago. Listen to what your team is saying, okay? And the information and insight they have may surprise you. There are actually a lot of bright ideas, no, in terms of recommendations coming from them, actually. So as a leader, you need to listen with them, okay? Lead with compassion. I would like to highlight this one. No? For your team to persevere through times of this crisis, pandemic, pressure, uncertainty, they need compassion from us, okay? This is not a time to move away from kindness, empathy, and caring, even if your brain's not just in that direction. So we need to lead with the heart and with compassion. We need to listen with them. Again, I salute to all of the frontline who actually work from day one up to this time. No? So salute to all of you. Compassion, another. One thing that coronavirus pandemic has shown us is that crisis is mentally, emotionally, and physically draining. So you're actually taking initiative in terms of the mental health, not just for the service, but also for the education, because a lot of us are actually experienced this during that time in terms of the holistic approach in terms of this situation. So again, be on the lookout for burnout. So we need to check on our people. How are you? As simple as that. Kamustahan, no? We have that virtual kamustahan, checking on our people during that time. No? And choose your sources of information wisely in terms of reliability and validity of the information coming in and out in terms of management for the COVID-19. Okay? And of course, stay flexible. This is just not just for the service, but also for the education. Flexibility is the key, okay? Because a lot of changes is happening right now in terms of information, policy, and procedure. So we need to be flexible in terms of facing the pandemic and the crisis. In this environment, it's critical to stay flexible and also open mind in terms of consideration for the best plans that they may be actually formulated, okay? And of course, we need to actually check on our people. We value our people. You know? Your immediate concern also, not just for the operations, okay, patient care, but also our people. They are, in terms of frontline, they are serving, giving their best, no? Handling COVID patient and facing the situation frontline. No? So we need to actually check on them in terms of their concern, listen to them, work with them. Okay, I remember during that time, visibility of a leader is very important. Okay, so we managed to actually visit some units, no, in terms of leadership walk, something like that. Okay, another discussion in terms of value for our employees. Actually, they will also need to make sure that their decisions are effectively, clearly, and continually communicated to employees. So cascaded down the line in terms of information. Okay, so we must share necessary information. We must speak the same language in terms of policy and procedures. Kasi nakakadagdag sa anxiety kapag iba-iba yung information. Okay, so we need to have concrete in terms of information. And of course, staying focused on what we can control. Hindi naman natin makontrol lahat, no? So, focus tayo dun sa makokontrol natin. So, stopping COVID-19 single-handedly is out on your hands, but you can control how you react to the challenges by following, of course, the recommendation of the experts. We can actually change our behavior or our reactions to the current situation. So that's maybe we can control in terms of leadership during the pandemic. Okay, so we need to be strong. Taking time to breathe, reflect, check on them. Okay, so leaders also need to actually self-care, something like that in terms of mental health, no? Down the line, no? From the leader up to the front line, the personnel. So thinking about how our new world in terms of COVID-19, we need to actually spend time, of course, with ourselves in terms of relaxation, in terms of mental health. No? As a leader, we need that also. So that you can refresh, recharge, and again, go back to work, manage the people, the situation, and of course, the entire organization. That will actually help us in terms of making concrete decisions that is actually based on your analysis, okay? Practicing gratitude, finding something positive every day. Of course, despite the pandemic, there's a lot of positive things coming in that COVID actually taught us. No? So we actually embarking on this principle in terms of service, checking on our people, kamustahan, kamusta kayo, you did a good job, you excel despite the pandemic. So practicing gratitude, positivity in terms of the environment. Okay. Of course, this is also taking care of ourselves as a leader and as a manager. Okay. We need to take care of ourselves also. So I have here a table, no, in terms of achieving a clear vision and values during a crisis. So on your left column, you have the task, no, be present, visible, and accessible. So this is what I'm going to share later in terms of the best practice. No, visibility is very important as a leader. Okay, so you need to check on them. No? As a matter of fact, if you actually manage to visit every unit during that time, no? So visibility is very important. Open door policy, accessibility. But of course, you need to follow the channel of communication. But then again, we are open in terms of issues and concerns. We value our people in terms of their issues and concerns. Lead by example. So a lot of people will actually lead up to you as a leader. So you need to lead by example. Okay. According here, it's not enough to have a set of values. You must actively practice them, maintain a calm, confident demeanor, even in adversity, okay? And take care of your physical and mental health, okay? So this is also, we are discussing a while ago. Take the lead, no? Take the responsibility. And of course, accountability. As a leader, you have responsibility and accountability. Attach, no? Being a leader. Do not wait for the crisis to resolve itself. Face that situation. Take charge of the situation and anticipate future situation, same related situation. And of course, seek out necessary information and support. In our institution, later on, going to share in terms of incident command post, we have that so that we can actually formalize information in terms of database in the entire organization. Provide education and training. Despite the pandemic, there's a lot of platform that we can actually utilize. Still, one of the targets in terms of delivering quality patient care is the competency. So it should never stop. Okay, so dapat tuloy-tuloy pa rin ang training and education in terms of the pandemic, no? And of course, empower people. So this is what I'm talking a while ago, no? Create a culture that welcomes prompt, balanced feedback, no? Feedbacking is very important. It's two-way, okay? Be observant and sensitive to issues in the team. Sabi nga nila, pag leader ka daw, tatlo yung tenga mo. Something like that. So be sensitive enough in terms of the issues and address that issue abruptly. No? Communication is the key. Tabletop discussion, pag-uusapan. Actively encourage team input about events and issues. No? Welcome suggestions for improvements. Siyempre, as a leader, hindi naman natin alam lahat, no, in terms of recommendations, innovations, and best plans. No? As a good leader, dapat you actually listen to your people then. They are actually having the best bright ideas then that you can actually take a look into. Okay. And of course, in terms of enhancing communication, for a lot of literature will tell you that in a crisis or in a pandemic or difficult situation, communication is vital. Okay, so that's why on my previous slide, no, hindi nawawala si communication. Communication is vital and crucial, of course. Decide who should be informed, when, and how. So you must have a lay down in terms of policy, scheduled of, for example, a meeting, or in terms of data, information, any platform will do. No? Okay, create an easily accessible central resource point electronically or paper. No, adjust your approach to audience considering the balance between sharing too little and too much information. So just share, no, in terms of the vital information that needs to be actually cascaded down the line. Use your initiative. Okay, find out as much as possible from a wide variety of reliable sources. Meron tayo dito, develop internal and external relationship with people who can offer advice and support. As a leader, you need that also. Yung mga consultants and other advice coming in, no? As a leader, we also need that. Okay, be open and honest, no? Managing people is a two-way. So listen to them in terms of cascading information, be open and honest, no, in terms of the situation. So dapat hindi natin itatago in terms of the data. It's fine to say you do not know everything. Share what you know and explain that you will share any information. Okay. Continuous naman yan. Developmental, ibig sabihin, no? Be clear and concise and accurate. Avoid technical details or overcomplicated information. Repeat key points several times, yung mga salient points, no, na dapat malaman ng tao. And keep statements clear and simple para mas mabilis ang dating sa tao natin. Course, listen. Ask open questions. Appear unhurried and relaxed. No? Maintain appropriate eye contact in terms of communication. Do not interrupt. For example, if you are having open communication with your people, allow them to talk. Hear them. Listen to them. Okay? Use responsive gesture or verbal feelers such as okay to show that you are listening. Of course, yung eye contact. Alam na natin yan, yung mga different strategies in terms of communication. So now, work as a team. Sabi nga natin, team, together everyone achieves more. During this time, during this pandemic, hindi natin kayang mag-isa. As a leader, you need your people, you need the participation of everyone, you need the help of everyone. Listen to your staff, be kind, but of course with control mechanism pa din, with boundary. Okay? Go and see them virtually. If possible, go them physically. No? During unit meeting, welcome them, kamustahin natin, cascade and update them with latest information. Of course, be visible. I make it a point during that time, when I was still a unit manager, COVID unit, I make it a point that I actually go inside the COVID unit wearing hazmat, be with them, observing them, what they do actually inside. As a matter of fact, there's one incident that during I came to the unit and then Dr. Hart came in or a patient went on arrest. And wearing the hazmat, I immediately do CPR, helping the nurses. And then I'll tell you, after that cycle of that situation, talagang basang-basa ka ng pawis. You understand kung ano yung mga pinagdadaanan nila. As in, pwede mo na siyang pigain talaga yung scrub ko during that time. So being with your people in these crying times, very important. Be visible enough. No? Mas makukuha natin in terms of yung heart nila, yung participation nila, yung cooperation nila, yung trust nila. No? Be visible. Okay? Of course, with the pandemic, no, hopefully, yung mga susunod na darating, we can actually anticipate and have contingency plan. Actually, lay down na yan dapat in terms of service, no? Anticipating for the future pandemic, no? Or management of emerging infectious disease, mga ganyan. Planning for the institution and operation. Because we already actually realize and reflect on the previous pandemic, no? So, magiging madali na yan for us in terms of the plan. Okay? And of course, I would like to share, no, what we did in our institution. During the day one of the pandemic, no, we create ICP, Incident Command Post. This is actually parang katulad din ng IATF. Parang katulad din siya ng principle ng One Hospital Command ng DOH. No? Siya ang lead during that time of pandemic, coordinating with different services, admin, medical, nursing, research, and training, convene in terms of talking with different issues, analyzing the trends in terms of data, in terms of census, in terms of admitting patients during day one up to this time. Okay, and of course we have daily bulletin. This is actually can actually utilized by the nurses, no? Easily accessible through the computer. So yung ano yung mga information na pinalabas ng ICP from day one up to this time in terms of policy, guidelines, etc. And of course, COVID strike team in terms of medical management for the people, for our patient. Of course, town hall meeting. Okay, our director is able to manage and conduct town hall meeting. Para siyang state of the nation address, no, for the entire organization. Okay, for us to be able to upgrade in terms of the information. And of course, creation of safety officer per unit, no, parang mga link champions, so that we can involve our people in terms of this pandemic. Sabi nga natin, we need to work as one. We need to we need the help of everyone, no? Especially the nurses in terms of addressing this pandemic. Okay, and of course, reconfiguration of the hospital structures. We are never actually prepared in terms of this pandemic. Okay, so reconfiguration meaning the usual facility converted to COVID facilities to be able to cater COVID patients. We manage in terms of zoning, hospital zoning, for example, the whole third floor, COVID zone or hot zone or danger zone. And we managed to actually staffing concern, for example, closure of one unit to be able to merge for that unit and to be able to supplement staffing. Okay, and of course, accommodation during the core of the pandemic, no, yung kasagsagan talaga na napakahirap, no, ECQ talaga, walang transport, etc. We managed to have accommodation for the staff, transportation, meal. This is also the same naman in other institutions. No? Psychosocial intervention for personnel and mental health. I remember nurses admitted for COVID, part ng care and management for them is actually a call from a psychologist or psychiatrist addressing mental health. So may mga regular na management, no, for that thing. And of course, for unit level, no, sa mga managers, they have this virtual kamustahan. You need to check on your people kasi syempre, they are the one in the front line with a lot of fear and anxiety. Okay? And of course, cascading of information. Visibility of managers. We managed to actually have leadership walk to be able to visit every unit, check on them, kamustahin sila, no? Ma-observe yung operations na during the pandemic. No? Of course, nandiyan yung fear during that time, no? Pero of course, sama-sama tayo in terms of this pandemic. And of course, in terms of decision, we managed to have decisiveness in terms of policies, procedures. For example, in terms of as simple as admitting patient, anong gagawin, no? Para hindi tayo malusutan in terms of positive COVID patient, mga ganyan. And of course, yun, leadership work. Now, for the education, no, actually this lead to shutting of all physical activity in terms of the school and colleges and universities, as you can see on the screen. So as a result, education has changed dramatically with the rise of e-learning. Yung mga learning management system natin, mga LMS, online platform, digital platform, no? Remotely. And research suggests that, actually, nagulat ako dito, online learning has had been shown to increase retention of information and take less time, meaning the changes of coronavirus have might be here to stay. So may mga ganyang findings, no, increased retention of information kasi focus ka din. So I have here simple illustration, no, in terms of the COVID-19 and its relationship to education as in a glimpse, no. Of course, with the utilization of the virtual lab online access, no, sa nursing kasi important pa rin na hindi mawawala in terms of competency. Nandiyan ang mga laboratory experiment, video demo, lecture assistant, no, remotely to assist. Sabi nga natin sa previous, hindi tayo techie, no, in terms of navigating the system. Of course, we need to check on our students, no, utilizing the modified blended learning, synchronous, asynchronous, no, and other parameters and methodology. And of course, later on, yung mga restriction, challenges, and limitations, lectures, materials, and of course, yung assessment natin. So meaning to say, hindi pa rin mawawala yung quality na talagang pinapromise, no, in terms of education. So I have here simple illustration, no, with the online education. We have here, of course, the online platform, the software, no, digital platform, and the other methodology or platform. We have the learning management system utilizing in our university. So these are the challenges in terms of the online learning. No? So of course, the number one dyan yung connectivity. So yung internet access or technology struggle, no, in terms of participating to digital learning, no, and of course yung mga computer natin, no, kung meron ba silang gadget, something like that, and of course this one, Staying engaged amid this pandemic is difficult for all of us, especially so for students. So when we actually do our online lecture in terms of education, no, dapat talagang magka-create ka ng environment na mai-involve sila. No? For example, naka-on ang camera or maraming mga pwedeng gawing innovation in terms of the online. So I remember during one of my master's class, merong isang team na nag-report, no, in terms of the topic. Tapos they are able to manage, may mga games sila, no, na magpa-participate ka rin remotely. So mabubuhay, no, may mga ganang innovation sila. And of course, connectivity issues. So be flexible, no. Hindi natin makokontrol, no, in terms of connectivity issue, lalo na kapag we have student from other provinces, no, Visayas, Mindanao, and other countries. So we understand that, no. So we understand that. Navigating issues, no, in terms of technology, advancement of technology. No? So prior naman to the implementation of this learning management, the university and other institution managed naman to give trainings, no, remotely. Trainings and education, no, for us to actually navigate the system. And of course, papasok din dyan yung self-responsibility in terms of upgrading yourself. No? So dapat, paano ba gawin to? We manage to actually educate ourselves. And of course, technical trainings both for student and faculty, and creating a classroom-like structured online platform. So based on literatures and experience, no, these are the effective strategies for students to engage in a deeper learning during this pandemic and this online platform utilization. So number one, take advantage of professional development and online resources. If your institution or your university manage to give trainings, no, and updates or education in terms of online, of course, take advantage of that. Maximize that, okay? Creating a welcome environment. No? So you can have a lot of methodology para makuha natin yung involvement ng student natin. Okay? Of course, open communication. You can actually ask them, no, in terms of sharing experiences, no, so that they can be involved. And of course, may mga games nga online, may mga ganon. Involve them, no. So dapat hindi lang siya one way coming in from the speaker or the instructor, no. Two-way din siya dapat, in a way. Focus on building strong relationship with students. We actually listen to our students. We actually communicate constantly with students, no. So be flexible. So build a strong relationship with our students. Kasi hindi rin natin alam yung mga pinagdadaanan nila in terms of online education. Consider other options, no? Of course, aware naman tayo dito. You have asynchronous and synchronous, self-directed education, self-directed activity once in a while, okay? Of course, without compromising the targets, no, and the competency and the quality. Teacher sensitivity. Okay, we need to be sensitive in terms of the actual problems coming in during the semester, in actually addressing issues and concern for our students also. Same with the service. And of course, flexibility is the key, no? Understanding without compromising quality. So we need to understand them, no? So may mga, for example, experience tayo na mawawala siya bigla, magbe-message siya, sir, medyo down po ang internet. We understand that, no? Basta hindi mawawala yung quality, yung target na makuha na information, no? And that actually responsibility from that student na to take charge, no, in terms of with the lessons during that time. And of course, feedbacking, no? At the end of every lecture or every session, kamustahin natin sila. How are you? Nakuha ba natin yung target natin, the objectives? Okay pa ba kayo, no? Minsan, ang ginagawa ko, for example, 3-hour session. In between, meron kaming mga exercise activity, no? Kahit online. Stretching, mga ganyan. Something parang physical pa din in a way, no? During our pre-pandemic. May mga ganon pa din. No? And manage actually to be flexible enough. For example, you can have your snack while listening to the report. Just make sure na hindi nga mawawala yung content or yung objective during that session. Okay? Okay, to summarize, no, both for clinical and service, importance of trust and creating it through action. As a leader, no, in leading our people, both for the service and of course, as a faculty or instructor in education, no, importance of trust and creating interaction is very important. Preparedness and planning, okay, is crucial. Supported and backed up with information and data when we do our decision, actually basing on data, okay. Adaptive, no? So, kaya napasok si adaptive leadership during the pandemic. Eh. We need to actually adapt with the present situation, no? And not to be reactive. And coordinative, no? Coordinated. Responsibility and transparency is very important. Pasok na natin ang accountability as a leader. Continuous learn process, no? So, hindi naman to isang cycle lang. In terms of leadership, in terms of managing our people, the entire organization, and of course, managing the class in terms of education or the colleges and university. Developmental to, meaning to say, we can learn pa, no, in this cycle. So it is a continuous learning cycle, no? And of course, madalas natin marinig, no, the concept of resiliency during a pandemic. This can actually be applied not just for the service, no, for all of us nurses, working both in service and in academe, no, resiliency is very important in terms of addressing and facing the situation right now, no, para makapag-perform tayo ng maayos and mabibigay natin what is expected from us in terms of patient care and in terms of a faculty or giving quality education to our students. Okay? So with now, I would like to end with this quote, no? A true leader asks advice when he has time to think, okay? But he never asks advice in a crisis. He acts, okay? And the true test of leadership is how well you function in a crisis. So with that, thank you very much po. I hope you learned something from today's session.
Okay. Magandang umaga, Professor.
Good morning.
And thank you for that very meaningful lecture. And for our audience, now you may input your questions to our chat box. Let me check. Okay, due to the time limited, so we will only ask one question. Is that okay,
yes,
Dr. Rakandola? Okay. So the question is, as a nurse leader, what are the learnings can we take from the pandemic to the post-pandemic era?
Actually, during this crisis, no, during this difficult situation, this pandemic was able to transform us actually to the best version of us in terms of managing and in terms of leading in general. No? So the pandemic taught us many positive ways, no, in terms of actually we see the potentials in other nurses, no, in terms of how we face the pandemic, how we act, how we give decision. This pandemic actually taught us, transform all of us, give our very best to adapt and to face the situation. Actually, when I have my reflection, no, during the pandemic, sabi ko, grabe pala yung pandemic during that time, no? We managed to actually face that pandemic and still we're here, no? Managing our people, managing the entire organization, managing our managers and staff, no? So again, what the pandemic taught us as a leader is actually how we handle the situation during these difficult times. And this pandemic transformed us actually to the best version of us in terms of leadership and management, because we can learn a lot of things during the most difficult and crying times. So lalabas talaga dyan yung the best version of self with the pressure, with the difficult situation, with this difficult scenario, no, during pandemic. It actually transformed all of us in terms of our potentials, in terms of the best version of us in terms of leadership and management. Maybe that's my realization during that time.
Okay, thank you for that, Dr. Rakandola. And now let's proceed for awarding the certificate. This certificate is hereby awarded to Dr. Joseph Peter B. Ragandola for his utmost participation as a resource speaker for the 4-hour webinar event entitled Innovation and Current Trends in Healthcare Technology, Nursing Education and Practice, given this 12th of March 2022 at the Philippine Women's University, Manila, Philippine via Zoom conference and Facebook Live. Signed by Mr. Herwin C. Kalakno, our class president, Ms. Zenaida Kilakil, our subject professor, and our beloved Ms. Minerva Diala, Dean of the School of Nursing. Thank you, Doctor.
Salamat. Ingat po kayo. Thank you.
Ingat.
Thank you for that wonderful discussion. And moving along for our fourth guest speaker. Our speaker has a distinguished career in nursing, a graduate from China Medical University in 2005. Engaged in acute and critical care for 15 years in Guangdong Province People's Hospital, served as head nurse for 8 years and deputy director nurse, and has worked in emergency ICU for 15 years. During her stay at Habianda Hospital, she has led the nursing team of emergency medicine and assisted doctors to save the lives of hundreds of critically ill patients. She took part in acute critical care work for a long time, which has accumulated a rich experience in the area of invasive and non-invasive ventilators, besides blood purification therapy and specialty in airway management, to which we will be hearing in today's webinar. Her ability to mobilize and illuminate led her to be awarded as the Excellent Head Nurse in 2014 and 2018, and won third prize of Emergency Specialist Nursing module in Langfang Emergency Microclass competition. She has been issued by the Chinese Nursing Association as an emergency medicine specialist and now an ICU nurse in Lodifei Hospital in Beijing, while being a medicine tutor in community of Langfang. With that, ladies and gentlemen, please join me in welcoming Ms. Yan Dunfang to discuss her expertise and knowledge regarding innovations in airway management.
It's my great honor to have such an opportunity to communicate and share with you here. In nursing for about 70 years, now I've been working in intensive care unit. So the topic I will share today is the innovation in airway management. Okay, let's begin. Okay. I don't know if you ever worked or studied in ICU. Airway management is very important for patient here because a lot of critical ill patients here need to establish artificial airways. Many patients require either tracheal intubation or tracheotomy and ventilator for assisted ventilation. The patient loses normal airway of protection and defension ability. The management of artificial airway actually contains many aspects. For example, the establishment of artificial airway fix, artificial airway balloon management, humidification of artificial airway, ventilator associated pneumonia prevention, and so many aspects. Because time is limited today, so we share two aspects. One is the establishment of artificial airway. The other is the management of artificial air balloon. There are many guidelines on the management of artificial airway in China, and the international authoritative guidelines are those the American Association for Respiratory Care, short for AARC. You can check out the guidelines on their website. Okay. Now, the first topic, the establishment of artificial airway, contains three aspects: artificial airway type, tracheal intubation, and the last one, tracheotomy. This is following the artificial airway. Now, the first you see is an orophageal airway and the nasopharyngeal airway, laryngeal mask, and tracheal intubation, and the last one is a tracheotomy. Now, all of this we use in the clinical, okay? And when we need to establishment of the artificial airway, now the natural airway no longer function as they should. May advance airway damage, airway protection is required, and the last one, the respiratory failure requires mechanical ventilation support. Okay, tackling the establishment of artificial airways, it's divided in two categories. Now, the first is a pharyngeal airway, and another is a tracheal airway. And the pharyngeal airway contains oropharyngeal airway and nasopharyngeal airway. Tracheal airway is divided two categories: tracheal airway intubation and tracheotomy. Now, we introduce the oropharyngeal airway. It's placed orally into the pharynx of the patient. It can prevent falling tongue, avoid tongue bites, and facilitate the sputum suction. Okay, for example, in a patient with cerebral hemorrhage, the tongue often falls back. The tongue of the patient blocks the airway so that the patient can breathe normally, and the oxygen saturate will decrease. And at this time, we need to insert the oropharyngeal airway into the patient to maintain normal respiratory function. Okay, how we use the oropharyngeal airway? Now, first you must check the length. Now, the length, the distance from the corner of the mouth to the angle of the jaw, and how to insert this oropharyngeal airway. The pharyngeal curve is inserted upward into the mouth when his front end approaches the posterior wall of the oropharyngeal tract. Rotate 180 degrees to the right position and push it down to the right position with both hands. Okay, it's not difficult. Now we introduce the nasopharyngeal airway. The main role of the nasopharyngeal airway reduce the damage of nasal mucus caused by sputum aspiration, prevent the root of the tongue falling back, can be used in cancer patients. Okay, this nasopharyngeal airway usually used in cancer patients. It is comfortable than the oropharyngeal airway. Now, how to use this nasopharyngeal airway? First, you check the length, distance from the tip of the nose to the airway. Okay, and how to insert this tube. Please along the physiological curve of the cavity. is not difficult. Let me okay. This is cuff. This is caster with scale. Now this is actual ring, so the line, and this is joint with outer diameter of 15 millimeter. And this is one-way wave indicate the ball and the ball filling wire. Okay, we know the details. Oh, this is the last one is a mobile air. Now this is types of the only one, and the second double lumen capacitor. We use the according to his use. Okay, this is a picture shows a sick elephant being intubated and ventilated by a ventilator. The elephant was successfully treated. Electrical intubation can save lives, and doctors are beginning to apply the technique to clinical practice. Now, this picture shows the upper respiratory anatomy. Now, this is the chin, nose, tongue, open airway, and throat, and oxygen. And the oxygen from the oral nose to the open air. Okay. This is picture is so the throat. It is very important part is epiglottis. This is epiglottis. Okay, the epiglottis. Now we need know the tracheal and the vocal fold. Now this is a picture, this is a video show the epiglottis, and this is a vocal fold, and this is a tracheal, the airway. We need to insert the intubation into this. Okay, before endotracheal intubation, we need to send consent from the patient or her family to inform the process of endotracheal intubation, the necessity and the possible situation, and obtain the consent of the patient. Meanwhile, we also need to provide items for endotracheal intubation. Now, this is the prepare the items. Now, this is the suction, drugs, oxygen, and this is the intravenous science monitor, and this is very important ABY. Usually we compare a tracheal intubation box. This is the tracheal intubation box. It contains into a tube, the tube and algae bag, a lot of items in here. Now, we also prepare the ventilator ready for the ventilations. Okay. We also need to set the patient position. I'll keep the lying position. We can see the pictures. Now this is oral axis. This is the pharyngeal axis, and this is a laryngeal axis. We need to this three axes, keep the three axes on the same level as possible. It is easier to insert the intubation. Okay. Before the insert the intubation, we need to give the oxygen filling in advance. Now then, we place the lyric scope. Now this is scope. We can see this is the pharynx, and this is epiglottis. And we insert this laryngeal scope. And now this we use the lyrical with video. Okay. Now expose the glottis and insert the electrical tube. Now this is tube. We can see the tube here. After place the electrical tube, we need to sputum suction, place the tooth mat filled with air bag, oxygen, and positive pressure ventilation, simple breathing bag. This is all of things we need to do. And then we need to assessment of tracheal intubation location. Now we can auscultation, thoracic motility, and the expiratory carbon-dioxide monitor. SpO2 monitor, ventilator waveform, X-ray. From the X-ray, we can see the tube position, and we can use a proctoscope. And then we introduce the tracheotomy tube. Now this is a picture, so the details. Now we can see the inflate tube and the one-way wave and the cuff, the outer cannula. It is the details you need to know. Okay, we introduce the tabs. This is one. The first one is a conventional, and this is one is air cut, and this is one bladeless air cut, and this is one is flexible air, and this is adjustable lines air cut, and this is metal gas. And now we usually do a percutaneous tracheotomy as opposed to a surgical tracheotomy. This technique is less invasive. So now we usually do the percutaneous tracheotomy. The last one with the topic, we need to sell the artificial airway balloon management. Okay, contains 4 aspects: airbag effect, airbag pressure requirements, balloon feeding technique, exudation from balloon. Okay, now we see the picture. After we insert the tracheal tube, we need to inflate the airbag so that the airway is closed and don't deflate it, prevent patient from aspiration, and prevent the occurrence of ventilator-related pneumonia. So it is very important, the balloon. Now we see the types of the airbag. Contains 3: low volume and high pressure airbag, high volume, low pressure airbag, and bubble bag. Now we usually use this one, a high volume, low pressure airbag. Okay, this is airbag pressure requirement. Excessive air sac pressure can cause mucus damage, fistula, airway stenosis, and neuropathy. Airbag pressure is too small, it can cause air leakage, aspiration. The distance of VAP was significantly increased. So recommended airbag pressure is 25 to 30. Now, this is equipment airbag pressure monitor. We use this to monitor the pressure. Airbag pressure monitor minus every 6 to 8 hours. Okay, now we can the picture. There's a lot of dirt on the top of the balloon. We call the hold up, mainly secretion from the mouth that flow down the airway to the top of the balloon. Okay, so it causes important to the formation of VAP here. Okay. Now, how to remove of the hold up from airbag? Now, reduce the incidence of VAP and reduce medical causes. Now, method, continuous internal drainage of subglottis secretion, air shock method to remove the residual material on the airbag. This is picture show the drainage of subglottis secretions. Now this is a machine suction. Okay, remove of the hold up. Okay, operation for drainage of subglottis secretions. Continuous short aspiration with suction. Monitor intracal pressure every 4 hours and maintain this pressure. Check system every 4 hours with 2 millimeters of air to ensure that the suction lumen is patent. Check the system if no secretion are recovered in the mucus collector. This is a measured air shock measure to remove the residual material on the airbag. At the end of the patient's inhalation and the beginning of the exhalation, the airbag is squeezed and the balloon is released when the lung is fully expanded to produce a large and fast expiratory flow rate between the ventricle and the wall. Secretion accumulated on the balloon are rushed off. Okay, how to operate this method? Now we need two people. Okay, 2 people cooperated. One person connects the airbag to the tracheal tube and squeeze it at the end of the patient's inhalation and the beginning of the exhalation. At the same time, the other person evacuated the airbag and inflated the airbag at the end of the breath. Check out the hold up airbag that have been flushed out of the mouth and nose. Okay, this above operation can be repeated 2 to 3 times until the bag is completely removed. Okay, that's all. Thank you very much.
Thank you, Ms. Yan Dunfang, for that very informative discussion of airway management. So just one last question for you from our live audience. They wanted to ask if what are the common challenges in intubation process of COVID confirmed patient in your area? Since COVID-19 is a very infectious disease, so what are the common?
First, assess the necessary of intubation every day and activation as soon as possible. Hygiene, raise the hand over bed or care. Aseptic technical operation procedures should be strictly followed when carry out operation related to the airway. Prevent aspiration, maybe use a filter and subglottis suction. In COVID-19, you can add aspiration filter. It's very important. Okay, that's all.
Okay, thank you, Ms. Shandon Fang. And on behalf of our class, we would like to award you with this certificate for your utmost participation as a resource speaker for our 4-hour webinar event entitled Innovation and Current Trends in Healthcare Technology, Nursing Education and Practice, given this 12th day of March 2022, the Philippine Women's University, Manila, Philippines, by Zoom conference and Facebook Live. Signed by our class president, Mr. Hiruin C. Calagno, our professors, Ms. Sinaida Kilakil, and to our beloved dean, Dr. Minerva B. De Ala, Dean of School of Nursing. Thank you, Ms. Shanding.
We have learned a lot from previous speakers, and I would also like to express my deepest gratitude for each and every one of our participants for staying and listening for today's webinar. To end event on a good note, we have to warmly welcome our last guest speaker, who will share with us an insight of current status and trends in robotics, to which is based on the application project of Da Vinci robot system that is currently being carried out in Henan Provincial Cancer Hospital. With a background of master's degree of nursing at Xinjiang Medical University in China, with 5 years clinical experience, engaged on a career mission committed to provide quality care for the patients, for the family members, and her communities through excellence in leadership, practice, innovation, and education. In addition to her amazing background, she is on her second-year doctoral degree in nursing at Philippine Women's University in Manila. With her extensive set of skills, high tech, and artificial intelligence background, her research interested are in development of application of stem cells in healing wounds, using of nursing technique, methods, and theories that help improve patients' quality of life. Let's give her a warm welcome, Ms. Meng Li, to discuss current status and trends in nursing.
Thank you. Good morning, ladies and gentlemen. My name is Lisa Mengli. I'm from Henan Province, China, and I am very happy to be invited into this webinar as a speaker. At the same time, I am also a PhD student at PWU, and there may be many students in the same university as me today, so we are a family. What I'm going to share today is about robotic nursing, which is a very interesting and meaningful topic. As we all know, the COVID-19 pandemic has strained the healthcare systems and the personal protective equipment supplies globally. A scholar, David, planned a prospective proof of concept feasibility and design pilot study to test 5 discrete medical tasks in a simulated ICU room using a collaborative robot. A training period of 45 minutes to 1 hour was needed to program the system for each task. In less than 30 days, the team completed 5 simple effector task experiment robotically. Selected collaborative robotic effector tasks appears feasible in a simulated ICU room of the COVID-19 patient. Theoretically, this robotic approach could reduce PPE use and staff exposure. It requires future validation and healthcare worker similar to other ICU device training. Another type of medical robots is social robots. Today's robots can recognize sounds, faces, emotions, interpret languages and gestures, respond to verbal and nonverbal cues, and even make eye contact. They are increasingly used to take care of the elderly, educate children,
and do all kinds of things in between. At present, Robot Pepper has emotional intelligence, so some people think they can play the role of home partner. So let's take a look at who needs company at home. There is no doubt that the children and the elderly. Children will have a good time with robots, but robots still cannot replace their parents. Any parent or caregiver with children knows this truth. Old people do need company, but what they are eager for is a time with the people they loved deeply, not with the machines all day. It is commendable that we can see that the robot company is only a supporting role, and they will not replace humans. However, it is not clear whether social robots will reduce the burdens on caregivers. The work efficiency of nursing robots will be improved in time, but there is still a long way to go. In addition, robots are widely used in the world. Daphne robot is a good example. And another one is the infertility surgery system, which is very helpful for people who with infertility. Robot dental patient harness for simulating dental patients and helping training dentists. It's good for their pre-clinical training and for them to be ready for their future career development. RP7 robot is a doctor who connects doctors and patients 24 hours a day. Robot for interactive body assistance is a repair nurse. Pushbot is an excellent surgeon. Vertibot helps with the virtual autopsies. The above practical applications confirm that science and technology are improving and making great progress. And our medical field also benefits from this progress. Of course, patients are the biggest beneficiaries, which is our ultimate goal. So, the reasons for choosing the robot. Number one is compared with humans, robots are quicker to train, cheaper to maintain, easier to refuel and repair, and less prone to be bored by repetitive tasks. They could help the elderly and chronically ill to remain independent, reducing the need for careers and the demand for care homes. According to the classification of the International Federation of Robotics, medical robots can be divided into the three categories: robotics the surgery, robotics the motor coordination, analysis and therapy, robot-assisted mental, cognitive, and social therapy. At present, robotics the surgery is more popular and industrialized all over the world. Next, let's talk about the practical application of robotic surgery defense system. Robotic surgery is not a robot to perform surgery for patients, but the surgeons uses robot surgery systems to complete minimally invasive and acute surgery. The surgeon performs surgery with defense system by using instruments that he or she gets via a console. Have you ever thought about the following scene? I love watching movies about robots, such as the Transformers series, Airman series, Scissorhands Edward, and so on. While watching, I was thinking about a question. Will fully automatic robots really replace human beings in the future? Can robots help do things that are difficult for humans to do? In order to find the answer, I tried to surf the internet for some information about the robots. One of the shocking news is the robots in a third-class hospital in Henan province can operate on the patients just like a surgeon. So let's talk about the defensive system in detail. Here is history of robotic surgery. In June 2000, defensive surgical system became the first automatic control mechanical system approved by FDA for laparoscopic minimally invasive surgery. In 2005, defensive S system was launched, followed by 2009, SI system was launched in the market. The most widely used clinical robotic surgery system includes a camera arm and mechanical arms with surgical instruments attached to them. The surgeon controls arms while seated at a computer console near the operating table. The console gives the surgeon a high-definition, magnified 3D view of the surgical site. The surgeon leads other team members who assist during the operation. Doctor control system. The movements of doctors' arms with fingers are accurately recorded in the computer through sensors and synchronously translated to the robot arm. Precise operation in a narrow operating field. The pedal can focus electrocoagulation and replace the control handle. It can also display ultrasonic image, ECG signals, blood oxygen saturation, cardiac dynamic function, anesthesia depth, and other signals on the same screen or on the split screen. Through the above introduction, we can see that one of its major advantages is to break through the limitations of manhand. Since there are 7 degrees of freedom, the defensive system translates the surgeon's hand movements at the console in real time, bending, rotating the instruments while performing the procedure. The tiny waisted instruments move like a human hand, but with a greater range of motion. Another advantage is to break through the limitations of human's eye. Because of its 3D magnified high-definition imaging system. Through this system, it allows the doctor to see the internal situation of the surgical site to ensure the safety of patients and reduce the occurrence of errors. Next is the bedside surgical manipulator system. It consists lens arm and 3 instrument arms. 2 mechanical arms and lens arms can be controlled arbitrarily during operation. The command is transmitted to 2 mechanical arms through the converter to perform cutting, separation, hemostasis, ligation, suture, and other operations. And the imaging system allows the doctor to adjust the magnification on the control panel on the doctor's console according to the different types of surgery. The assistant makes a mark on the touch monitor, and the operator can see it on the console to enhance the cooperation and guidance of the surgery. Now let's talk about the cooperation of the circulating nurses. The important role is the preoperative interview. It includes the nurse should visit the patients in the ward 1 day before the operation, give health education, understand the needs of the patients, and puts the patient's needs first. Since we have the nursing concept, patient-focused. And the chief surgeon needs to communicate with the patient and their family about the relevant knowledge and introduce the detailed steps. The purpose is to relieve the patient's fears and anxiety. Before the operation, the nurse should ensure the operating room has a proper equipment, any positioning devices, and the operating room table is in correct position. Anesthesia circuit and suction is hooked up. Warmer and sequential compression devices are readily available. Counting shops and sponges with the scrub person. And during the operation, safe use of the equipment, strictly control the effusion rate and record in and out volume in time. Take the skin care seriously, correct placement of the surgical position, rational drug use management, and timely adjust the temperature of indoor temperature changing blankets. And now let's talk about the cooperation of itinerant nurses. Itinerant nurses' jobs are prepares sterile supplies, sponge count, maintains sterility, gown glove assistance, and something like this. Their major job is to make the consumables sterile, with no contamination. Besides of this, in case of any situations inconsistent with the preoperative diagnosis or any emergency occurs, the nurse should quickly figure out the idea of nursing cooperation, timely prepare the required items and instruments, form an integrated surgical cooperation with the surgeon, and have the emergency ability to deal with surgical accidents, such as the tracheal intubation, tracheotomy, cardiopulmonary resuscitation, and so on. After the operation, we should clean the consumables and make them sterile. Now let's talk about the future development of robotic surgery. Development direction of robotic surgery. Single-hole laparoscopic surgery robotic system is the improved speed, since this can greatly reduce the trauma to the patient and make less scars on the skin. The microsurgical robot system make it easier to operate and more applicable in environments. The third one is Vero tactile sensory technology, creates a new active tactile feedback system. Number 4 is it can realize remote robot system, especially now in the new situation of the COVID-19 pandemic. A new direction for minimally invasive surgery. Surgeons who use robotic surgery found that for many procedures, it enhances precision, flexibility, and control during the operation and allows them to better see the size compared with traditional techniques. Using robotic surgery, surgeons can perform delicate and complex procedures that may have been difficult or impossible with other methods. And it can appropriately expand the scope of use of surgical patients, since it can add elderly patients and high-risk patients. Besides of this, it also can approximately expand the range of efficiency and popularity of the hospital, significantly reduce the length of stay and improve bed turnover. Multi-department application to attract more patients. It can create more opportunities for clinical research and international exchange. But behind of this, it also had some limitations, such as expensive capital and running cost, no tactile feedback, reduced train experience, lengthy setup times, large layouts, and it may require extra storage space. Most articles emphasize the importance of the patient safety. It can be noted that few studies involved the cognition of nurses, the role of surgeons, and the surgical technology itself. The recommendation includes the need to strengthen the research on the human-computer interaction, pay more attention to monitoring of robots, and analyze the psychological obstacles to be overcome in order to achieve greater tolerance and acceptance of the robots. So, in conclusion, also in its infancy, robotic surgery has proven value in areas of inaccessible conventional procedures. It has the potential to expand surgical treatment modalities beyond the limits of human ability. Although feasibility has largely been shown, more prospective randomized trials evaluating efficiency and safety must be undertaken. In the future, it needs more evidence-based medicine and nursing. We believe robots have a promising prospect, and the patients can benefit from this improvement in a large extent. Here is the references, and that's all. Thank you for listening.
Okay, thank you for your very informative lecture, ma'am. And to our participant, you may now input your questions to our chat box. 非常感谢李博士跟我们的分享啊，然后现在我们就会找几个问题来问一下您啊。Okay, now here is a question from. Okay. Okay, the question is, can you tell us about the maintenance and upkeep of Da Vinci surgical robot? Thank you.
Thank you. The Da Vinci surgical robot has brought a lot of pressure to the staff of the disinfection supply center due to its complex structure, expensive and irreplaceable characteristics. The steps include cleaning, disinfection, drying, maintenance, and inspection. For the staff of the supply center, the above steps are only the details that need to be paid attention to. It's very easy for them to do. The real difficulty is the preparation before cleaning. It includes removing the attachment. Be careful not to use excessive force when removing accessories and damage the instrument. Yeah, that's all. Thank you.
Okay, thank you for that wonderful answer, ma'am. And so now let's proceed for awarding our certificate. This certificate is hereby awarded to Mr. Meng Li for her utmost participation as a resource speaker for the 4-hour webinar event entitled Innovation and Current Trends in Healthcare, Technology, Nursing Education, and Practice, given this 12th day of March 2022 at the Philippine Women's University, Manila, Philippine via Zoom conference and Facebook Live. Signed by Mr. Herwin C. Calagno, our class president, Ms. Zenaida Clakil, our subject professor, and our beloved Dr. Minerva de Ala, Dean of the School of Nursing.
Thank you so much.
Thank you, ma'am.
Thank you for that. It has been a successful event and productive morning. Don't you think, guys? And now, to officially close our webinar, let us hear from one of our classmates, co-webinar facilitator, Ms. Sandra Intal, for her closing remarks.
Good afternoon, everyone. It's very pleasing to see all of you. Respected speakers, attendees all over the country and even abroad, my co-facilitators, our beloved Professor Zenaida H. Kilakil, the Dean, and the whole PWU, thank you. I would like to take this opportunity to thank all of you for your utmost and very heartwarming support to make this webinar event possible. Again, I am Sandra Intal, one of the facilitators of this very informative webinar entitled Innovation and Current Trends in Healthcare Technology, Nursing Education and Practice. Ladies and gentlemen, I believe that even though we only had a limited time to tackle a lot of interesting things with regards to our topic, we still got the most out of it. Our respected speakers, Dr. Marilu Furio, Dr. Joseph Peter Regandola, Dr. Maria Doris Rosales Obias, Miss Yan Binvan, and Miss Meng Lee have provided us with such information that will surely give us an edge in our profession. Probably at this moment in time, your great minds are already loaded, and I would not take much of it. I would just like to send my gratitude to everyone, especially to my classmates and co-facilitators of this class, because this event made us a team and allowed us to be closer with one another. It somehow molded us to become a leader in our very own ways, as PWU is molding us. Again, to all, good afternoon and a big thanks. May God bless us all and keep us healthy, especially at this time of the pandemic.
Thank you for that, Ms. Intal. And on behalf of our team, so everyone
On a last
who
note,
attended,
we would like to request our dear participants to kindly accomplish the evaluation form via the link that will be provided in the chat box. Failure to accomplish this evaluation form will be prohibited or will prohibit you from having an e-certificate for the event. Expect your e-certificates in your personal emails at least a week after this event. Thank you and have a great day.
thank you everyone. Have a great day and stay safe.